Oh shit, hold up. It started. Hold on. We got it. We got it live. We got it live. We got it live.
70-year-old men, 1 in 34 in my kids' generation. We've seen this explosion of autoimmune disease, of allergic diseases. This is not just a economic issue. It's not just a national security issue. It is a spiritual issue, and it is a moral issue. We cannot live up to our role as an exemplary nation, as a moral authority around the world, and we're writing off an entire generation of kids.
Thank you very much. And if confirmed, how could we work together to integrate nutrition-based interventions into our healthcare programs like Medicaid and Medicare?
Well, there are many ways that we can do that. A federal funding of the SNAP program, for example, and of school lunch programs.
First, let's just get healthy. First, let's just get healthy food, bro.
Kids. We shouldn't be giving 60% of the kids in school processed food that is making them sick. We shouldn't be spending 10% of the SNAP program on sugar drinks. So we have a direct ability to change things there. We also, in Medicaid and Medicare, we need to focus more on outcome-based medicine, on putting people in charge of their own health care, of making them accountable for their own health care so they understand the relationship between eating and getting sick.
Yes.
Most importantly, we need to deploy NIH and FDA to doing the research to understand the relationship between these different food additives and chronic disease so that Americans understand it and make sure that Americans are aware of it. I don't want to take food away from anybody. If you like a McDonald's cheeseburger, a Diet Coke, which my boss loves, you should be able to get them. If you want to eat Hostess Twinkies, you should be able to do that. But you should know what the impacts are on your family and on
Absolutely.
your health.
Thank you. Senator Wyden.
Thank you very much, Mr. Chairman. Before I begin my questions, I'd like to start by entering into the record a letter the committee received from Ambassador Carolyn Kennedy outlining what she believes is Mr. Kennedy's lack of personal fitness for the office.
Without objection.
Mr. Kennedy, you have spent years pushing conflicting stories about vaccines.
No, he hasn't.
You say one thing.
No, he hasn't.
And then you say another. In your testimony today under oath, you denied that you were anti-vaccine. But during a podcast interview in July of 2023, you said, quote, "No vaccine is safe."
Or maybe we can watch it on Fox.
In your testimony today, in order to prove you're not anti-vax, you note that all your kids are vaccinated. But in a podcast in 2020, you said, and I quote, "You would do anything, pay anything to go back in time and not vaccinate your kids." Mr. Kennedy, all of these things
I think what pisses me off.
cannot be true. So, are you lying to Congress today?
Like, who is this guy?
You are pro-vaccine?
Who is this fucking dude? Mr. Wyden.
Those podcasts.
We're going to find out who all these characters are.
Yeah, Senator, as you know, because it's been repeatedly debunked, that statement that I made on the Lex Friedman podcast was a fragment of the statement. He asked me, and anybody who actually goes and looks at that podcast and will see this. He asked me, are there vaccines that are safe and effective? And I said to him, some of the live virus vaccines are. And I said, there are no vaccines that are safe and effective. And I was going to continue for every person. Every medicine has people who are sensitive to them.
Absolutely.
Including vaccines.
Right. So
he interrupted me at that point. I've corrected it many times, including.
It's like they try to do like a gotcha. This isn't no fucking gotcha.
let's be clear about what you've actually done then, since you want to deny your statements. For example, you have a history of trying to take vaccines away from people. In May of 2021,
Like, who is this dude? Who is this dude to question RFK?
not only block Americans from having access to the COVID vaccine, but to prevent any future access to the life-saving vaccine. Are you denying that? Your name is on the petition.
We brought that petition after The CDC recommended the COVID vaccine without any scientific basis for 6-year-old children. Most experts agree today, even the people who did it back then, that COVID vaccines are inappropriate for 6-year-old children who basically have a zero risk from COVID. That's why I brought that lawsuit. I don't want to. I want to emphasize
Mr. Kennedy, the facts.
I don't.
The facts.
Yeah!
Committee will be in order.
Fuck these niggas.
And to the audience.
I swear to God. We're not going for no bullshit.
Hold off for a second, Mr.
We'll shut the whole shit down.
Comments from the audience are inappropriate and
No, you inappropriate. Maha, make America healthy again. We're not falling for your shit. Put him in office. Flat out.
order.
Flat out.
Please follow the rules of
No, it ain't no rules, bro, because y'all don't follow the rules. You get up here, you try to ask these little shiesty, weird questions. We know your tricks, bro. We know your tricks.
Absolutely wrong, and you know it's wrong, and you know it's wrong.
We'll get to that in a moment. Right now, we're talking about the petition that you filed to block
You see, they'll do anything to keep this man from getting in office.
and to prevent any future access to the vaccine. Those facts are on the record. My third question to you is, you made almost $5 million from book deals, mostly promoting junk science. In 2021, in a book called The Measles Book, you wrote that parents had been, quote, misled into believing that measles is a deadly disease and that measles vaccines
Let me get some water.
are necessary, safe.
Let me get some water.
The reality is measles are in fact deadly and highly contagious, something which you should have learned after your lives contributed to the deaths of 83 people, most of them children, in a measles outbreak in Samoa. So my question here is, Mr. Kennedy, is measles deadly, yes or no?
The death rate from measles historically in this country in 1963, the year before the introduction of the vaccine, was 1 in 10,000. Let me explain what happened in Samoa. In Samoa, in 2017 or 2015, there were 2 kids who died following the MMR vaccine. And the vaccination rates in Samoa dropped precipitously from about 63% to the mid-30s. So
They'll do anything they can to slander
in
him.
2018, 2 more kids died following the MMR vaccine, and the government of Samoa banned
Anything
the
they
MMR
can to make him
I arrived
to
a year
put
later.
RFK in a bad light. They'll do.
We're already below any previous level. I went there, nothing to do with vaccines. I went there.
Anything they
to
can
use the
to
medical informatics
put him in a
system,
bad light. They will.
would digitalize records in Samoa and make health delivery much more efficient. I never gave any public statement about vaccines. You cannot find a single Samoan who will say, I didn't get a vaccine because of Bobby Kennedy. I went in June of 2019. The measles outbreak started in August. Oh, clearly I had nothing to do with the measles. Not only that,
Mr. Kennedy,
Senator, not only that, if you let me finish,
You
Senator,
have had some time.
if you
and
let
No,
me
let him finish.
if you let me finish,
Let him finish.
83 people died when the tissue samples were sent to New Zealand.
They're like, oh, you're anti-vax. That's it. No, well, let him finish. These niggas make me so angry.
Heard in Tonga and Fiji, and no extra people died. There were 7 measles outbreaks in the 13 years prior to my
Chairman, I just
arrival.
would like to get my time back. The nominee wrote a book saying that people had been misled.
This nigga's paid off by Big Pharma. I'm tweeting it.
He's trying now to play down his role in Samoa. That's not what the parents say. That's not what Governor Green says. It's time to make sure that we blow the whistle on actually what your views are. At least we're starting.
we need to move
Senator,
on.
I support the measles vaccine. I support the polio vaccine. I will do nothing as HHS secretary that makes it difficult or discourages people from taking either of those
Anybody
vaccines.
who believes that ought to look at the measles book you wrote saying parents have been misled into believing
Like,
that measles is a
We're not worried about no fucking measles book, Mr. Wyden.
Senator Grassley.
Jesus Christ. You about to upset all of us now.
I'm going to do like I did in my office. I'm just going to make some points to you. I got about 7 I want to quickly get done. And then At the end, I'm going to ask if you disagree with anything I say, and then address those things you disagree with. I'll make sure I save time for you to do that. A key responsibility of each member of Congress is oversight. Oversight allows us to hold bureaucrats accountable to the rule of law, and it helps keep faith with taxpayers. I expect HHS to provide timely and complete responses to congressional oversight. Number two, PBMs, something you and I discussed in our office. I've been working
look at the line.
pharmacy benefit managers accountable in order to lower prescription drug prices.
The crowds are immense.
To hold
RFK
accountable, and that may even asking your support for legislation that's before the Congress.
The support is immense.
Drug pricing. Senator Durbin and I have for a while been trying to get a bill passed that requires price disclosures on TV ads for prescription drugs. Knowing what something costs before buying it is just common sense. President Trump tried to do this by regulation in his first term. Vice President Vance co-sponsored our bill last Congress. I ask you to support this bill, or if you can do it by regulation, to do it by regulation. On rural health care, the previous administration dragged its feet in opening up slots for rural community hospital demonstration programs. It also ignored concerns from rural pharmacies when implementing changes to Medicare Part D, and ignored rural needs when it comes to distributing physician residency slots. I expect you to prioritize rural Americans' healthcare needs. On agriculture, in our meeting earlier this month, we talked at length about agriculture. You prefaced the conversation by saying you will not have jurisdiction over these issues. I expect you to leave agricultural practice regulations to the proper agencies, and for the most part, that's USDA and EPA. On dietary guidelines, I've sent letters to the Secretaries of Agriculture at HHS requesting that they provide information regarding conflicts of interest on the Dietary Guideline Advisory Committee to increase transparency. I expect you to provide Congress with confidential financial disclosures from the advisory committee before finalizing dietary guidelines, so we know that nobody has a vested interest in it, is having undue influence. Lastly, HHS, Office of Refugee Resettlement Oversight. Last year, I expanded my investigation into HHS's Office of Refugee Resettlement. I wrote 24 contractors and grantees whose job it is to place unaccompanied children with sponsors. In many cases, children
Sponsors?
have been placed.
Who are these people?
With improper vetted sponsors,
Like, for real.
them at risk of trafficking.
I've never seen this guy in my life.
HHS directed these texts
But, like, does he even, like-
contractors and grantees to not respond to my inquiry. This is obstruction by the executive branch. I expect you to produce to me the records and data I've requested, and instruct HHS contractors to fully cooperate with my investigation. I also expect HHS to not retaliate against any whistleblowers, including those who identify ORR's failures in vetting sponsors of unaccompanied. You got 45 seconds to respond if you want.
I agree with all of those provisions, Senator. My approach to administration HHS will be radical transparency. If members of this committee or other members of Congress want information, the doors are open. I've spent many years litigating against NIH and its sub-agencies. HHS and its sub-agencies, NIH, CDC, FDA, on FOIA issues, trying to get information that we, the taxpayers, paid for, and oftentimes getting back redacted copies after a year or 2 years of litigation. That should not be the case. And if Congress asks me for information, you will get it immediately.
Thank you.
Thank you, Senator.
That's all we're
Campbell
asking
is
for is
next,
transparency.
but until she returns, I will move on to down the list, and that would be Senator Cornyn.
Mr. Kennedy, welcome to you and your family, and congratulations. I appreciate Senator Grassley raising the issue of the Office of Refugee Resettlement within the auspices of Health and Human Services. I think this may surprise people, but that's actually the responsibility of HHS, the Office of Resettlement Relocation. Under the previous administration, as Senator Grassley alluded, there were roughly 500,000 children, unaccompanied minors, that were placed with sponsors in the interior of the United States. The previous administration took the position that it was not the federal government's responsibility once these children were placed with these sponsors. But the New York Times, in a series of investigative stories, pointed out that tens of thousands of these children, when they tried to follow up and find out how they were doing, whether they were going to school, whether they were being trafficked or abused, there was no answer, and they took the position it was not their responsibility. So I look forward to working with you to find those children and to make sure
we'll work
that
back
they're
with you.
not
We'll work with
being
you.
abused.
You work with us, we'll work with you.
Millions of Americans are experiencing mild to moderate mental health and substance abuse issues, yet many struggle with timely and effective access. Primary care physicians are most likely to be seeing these individuals as opposed to a specialist, and it makes it important that these individuals, primary care physicians, be trained in patient-centered care, which would strengthen the integration of behavioral health care with primary care services. Is this something that you are concerned about, something you'd be willing to work with us on in order to implement?
Yes, Senator. Let me just reassure you that President Trump has personally spoken to me about locating those 300,000 children who disappeared over the last 4 years.
I don't think anybody has a fully accurate number, but it's hundreds of thousands, I agree.
And many of them we know have been sex trafficked and childhood slavery, and it is a blight on America's moral authority, and we need to find those kids. In terms of addiction services and substance abuse services,
Look at this girl behind me.
It was a priority for me. It was a priority for me when I was running for president during my campaign. I was a heroin addict for 14 years. I've been 42 years in recovery. I go to 12-step meetings every day, so I hear the stories every day. And I hear the many stories about denial of, or the barriers to access to care. And we need to improve that. And to answer specifically to your question, I think we can do that through GME, which is a program that is funded by HHS, that is the largest funder for medical school students. And that's one of the things for primary care physicians should understand addiction care. Addicts almost always go through a cycle where there is a moment where they hit periodic bottoms where they're ready to go into treatment. But it's fleeting and it's momentary.
Yeah.
And we have that opportunity to save their lives. And then if we miss that little short window, they're off to the races again.
Yeah,
Let me.
That's
I appreciate your answer.
That's
Our
anything,
time is
any
short.
substance.
Let me get to one more
Weed,
question
alcohol.
that I think is very important. Under the first Trump administration, the number of people receiving HIV treatment in Africa through the President's Emergency Plan for AIDS Relief, otherwise known as PEPFAR, it increased, this is during the first Trump administration, from 13 million people to 18 million people across 50 countries, primarily in Africa. Africa has about 1.3 billion people today, or in 2021, is projected to have 2.5 billion people by 2050, or 25% of the global population. In 2020, PEPFAR reported that 2.8 million babies were born without HIV. That was something that would not have happened but for the PEPFAR program. So it has simply been one of the most successful public health programs in the world and saved approximately 26 million lives. Failure to continue this program, in my view, would risk ceding that leadership to adversaries like China. And I'd like to know whether you support the objectives and goals of PEPFAR, and would you work with me and my colleagues to make sure that this program continues?
Absolutely. We'll
to
work with
provide
you. You work with us.
life-saving antiviral drugs to
You work with me. We'll work with you.
I absolutely support PEPFAR, and I will happily work with you to strengthen the program.
We already told you that.
Thank you. Senator Bennett.
Thank you, Mr. Chairman. Thank you, Mr. Kennedy, for being here this morning. And I think that, Mr. Chairman, we are truly through the looking glass this morning here in the U.S. Senate, and this committee is being asked to fulfill a really important responsibility, which is to decide whether to confirm Mr. Kennedy to one of the most important healthcare jobs in America. And the reason I think it's so important is for many of the reasons you said in your opening statement, which is that we live in the richest country in the world, and we have some of the worst health outcomes of any industrialized country in the world.
Like what?
We live in the richest country in the world.
Like what?
We have some of the lowest
Life expectancy
rates of anybody.
We're living 10 years less on average than every other major nation in the world. 10 years on average.
I can tell you that Mr. Kennedy's right, that when I look at the kids in the Denver public schools, if we don't change the way we eat in this country, 40% of them are going to suffer adult diabetes as a result of their diet. And we're, as I said, spending more than any other country in the world, and our families, every single person's constituents in this Senate are facing chronic shortages when it comes to health care. My friend from Texas, Senator Cornyn, has been a champion on mental health care. We have an epidemic, as he knows, across this country.
A pandemic?
In mental health care, partly because of what the massive social media platforms that were sitting behind the President of the United States have inflicted on our children for their profit in the last decade or so. So we have no shortage of challenges to...
So who are we talking to?
And I even agree with...
Who are we talking to? Right? Chris, who are you? We're talking to Big Pharma. We're talking to the ADA. We're talking to the FDA. We're talking to the NIH. We're talking to Kellogg's. We're talking to General Mills. We're talking to Monsanto. We're talking to you. We're talking to Moderna. We're talking to Pfizer. We're talking to all the corrupt interests that has entrenched. We're talking to DuPont. We're talking to 3M. All of the corrupt interests that have found their way in our food system and just been poisoning us for profit because it's more convenient for them. All right, where are we going to dispose of this waste? We'll put it in the shit, and we don't have to get it, right? No more of that.
And school districts all over this country would be better off not getting vaccinated than getting vaccinated. Unlike his own children who were vaccinated, unlike the people he invited to his house in Los Angeles for their party who were vaccinated. For everybody else, it's about peddling these half-truths. And he says it with such conviction that you want to believe him. And Mr. Kennedy, I just have there are many, many things in the record, but I hope that you could answer these questions, yes or no. I've tried to ask these in a manner that's faithful to what you actually said, because I didn't want to have a debate about whether you actually said them. So I'm asking you yes or no, Mr. Kennedy. Did you say that COVID-19 was a genetically engineered bioweapon that targets black and white people, but spared Ashkenazi Jews and Chinese people?
I didn't say it was deliberately targeted. I just quoted an NIH-funded and NIH published study.
Did you say that it?
Why is that relevant?
Black and white people, but spared Ashkenazi Jews.
I quoted a study, Your Honor. I quoted an NIH.
Why is that relevant?
I'll take that as a yes. I have to move on.
Shut up!
I have to move on. Did you say that Lyme disease is
Who are these bad actors?
likely a materially engineered bioweapon. I made sure I put in the highly likely. Did you say Lyme disease is a highly likely militarily engineered bioweapon?
I probably did say that.
Did you say that?
And that's what the developer of
I
Lyme
want all
disease
of our
said.
colleagues to hear it, Mr. Kennedy.
Like, this isn't a gotcha, bro.
You said yes.
This isn't a
Did you say that
gotcha.
exposure to pesticides causes children to become transgender?
No, I never said that.
Okay, I have the record that I'll give to the chairman, and he can make his judgment about what you said. Did you write in your book, and it's undeniable, that African AIDS is an entirely different disease from Western AIDS? Yes or no, Mr. Kennedy?
I'm not sure if I made that.
Okay.
Why is that
Mr.
relevant?
Chairman, Mr. Kennedy, and my final question, did you say on a podcast, and I quote, "I wouldn't leave abortion to the states. My belief is we should leave it to the woman. We shouldn't have the government involved, even if it's full term."
Who is this guy?
Did you say that, Mr. Kennedy?
I want to start finding out.
Every abortion is a tragedy.
Did you say it, Mr. Kennedy?
I
This
believe.
matters. It doesn't matter.
It doesn't matter.
Come here and say that isn't
It doesn't
true.
matter.
It's not reflective of what
You're asking him about COVID and abortion. Come on, bro. Who is this guy? Who cares? Health care and basic mental health care to them. It's too important for the games that you're playing, Mr. Kennedy. And I hope my colleagues will say to the president, I have no influence over him. I hope my colleagues will say to the president, out of 330 million Americans, we can do better than this.
Thank you. We need to move on. Senator Cassidy.
Mr. Kennedy, President Trump has sworn to protect Medicare. Republicans are exploring reforms to Medicaid that could help pay for Trump administration priorities. With this context, what will you do about dual eligibles?
About,
Dual eligibles.
well, dual eligibles are not right now served very well under the system. Those are people who are eligible for both Medicaid and Medicare. I suppose my answer to that is to make sure that the programs are consolidated, that they're integrated, and the care is integrated. I look forward to working with you, Dr. Cassidy, on making sure that we take good care of people who are
Thank you.
dual eligible.
And how do you propose that we integrate those programs? Does Medicare pay more, Medicare pay less, Medicaid pay more, Medicaid pay less? How do we do that?
Well, I'm not exactly sure because I'm not in there. I mean, it is difficult to integrate them because Medicare is under fee-for-service.
200,000.
For by
200,000.
taxes. Medicaid is fully paid for by the federal government, and it's not fee-for-service.
No, 500,000. 500,000.
I do not know the
Right.
answer to that.
It doesn't take long to find out why these guys are against Robert F. Kennedy Jr. Yeah, I would be too if I got 500,000 from Genetic Incorporation or Abbey V Incorporation or Eli and Lilly or Johnson and Johnson or whatever these sham companies. I'd probably be a little quiet. I probably wouldn't like Robert F. Kennedy Jr. It doesn't, right? It's not that complex, guys.
I'm very happy.
This is just how the game goes, man.
People are unmedicated.
And it's a whole different guy now.
Too high, the deductible.
They probably moved to the next guy, but I want you guys to understand that anybody that is opposed to them, just zoom in a little bit, right? Why? You want poison in the food? Oh, you got $500,000 from Big Pharma. Okay, it makes sense. Oh, you getting paid by... Okay, I got you now. Next guy. That wasn't that hard, was it?
Poorest Americans are now being robbed. Their services have dramatically decreased, even though we've increased the price of Medicare by 60% over the last 4 years. The target.
No, hey, we're gonna do this for everybody.
With that said,
We're gonna do this for everybody.
Obviously, you've thought about that, and I appreciate that. What reforms do you recommend, again, that would improve services, I suppose, but also make it more cost efficient?
Well, President Trump has given me the charge of improving quality of care and lowering the price of care for all Americans. There are many things that we can do. What we want to, the ultimate outcome, I think, is to increase transparency, to increase accountability, and to transition to a value-based system rather than a fee-based system.
So
rather than a service-based
on
system.
Medicaid in particular, can you just kind of take those kind of general principles and apply?
For one, we're not fucking talking about Medicaid. We're talking about making the food quality better. We're not talking about healthcare right now. We'll get into that conversation later. Right now, we're trying to make sure the food is just healthy. We're not talking about Medicaid. Stop talking about Medicaid, bro. We're not talking about Medicaid. We're not talking about healthcare right now. We're talking about increasing the quality of our food. These niggas is just throw any fucking, yeah. A fucking, like, these things have no,
Well, I don't have a broad proposal for dismantling the program.
Of course not saying that.
I think what we need to do is we need to experiment with pilot programs in each state. We need to keep our eye on the ultimate goal, which is value-based care, which is transparency, accountability, access.
And one more thing, going back to Medicare, you mentioned you're an MA. You mentioned earlier the Medicare fee-for-service. Do you have any kind of thoughts as to whether or not patients on fee-for-service should move into MA, or how should we handle that?
Whether patients
who are on Medicare fee-for-service.
Traditional Medicare,
Yes.
that's their choice right now. We have, I think, 32 million Americans, or 30 million Americans on Medicare, on traditional Medicare, and then another 34 or 34 on Medicare Advantage, roughly half and half. And I think more people would rather be on Medicare Advantage because it offers very good services, but people can't afford it. It's much more expensive. In answer to your first question, there are all kinds of exciting things that we can be doing, including cooperatives, which President Trump has supported, including health savings accounts, which President Trump has supported. But all of these things to make people more accountable for their own health.
And so we'd bring the cooperatives and the health savings accounts into Medicare and Medicaid?
Exactly. We try to increase those, the use of those, and to direct primary care, to continue to transition into a value-based program that is private. Americans don't, by and large, do not like the Affordable Care Act. People are on it. They don't like Medicaid. They like Medicare, and they like private insurance. We need to listen to what they would prefer to be on private insurance. Most Americans, if they can afford to be, will be on private insurance. We need to figure out ways to improve care, particularly for elderly, for veterans, for the poor in this country. And Medicaid, the current model is not doing that. I would ask, any of the Democrats who are chuckling just now, do you think all that money, the $900 billion that we're sending to Medicaid every year, has made Americans healthy? Do we think it's working for anybody? Are the premiums low enough?
We do need to move on. Senator Warner.
Well, I got to tell you, for literally hundreds of thousands of Virginians, Medicaid is
this is their last grab for power. This is their last grab for power, right? Oh, we still got this. No, you don't. The power is already out of your hands. You don't even know it yet. The power is already out of your hands and you don't even know it yet. U.S. senators. And I'm going to tell you why. Because I got my eyes on you now. We can all see what you're doing. So if you wanna,
vote. I voted for 4 of President Trump's nominees already. Got a lot of grief from folks on
I
the
don't care about that.
But I got to tell you, I saw an email that you put out Monday night, or your campaign did, in a fundraising email. Your presidential campaign celebrated that the freeze on all new regulations, guidance, and announcements is a way to protect unelected bureaucrats from further undermining our health freedom. Then you ask your donors to help pay for your campaign time. Did your campaign and you put out that?
I don't think my campaign exists anymore.
All right, well, listen, I got to tell you this.
Dumbass.
Somebody's out there soliciting money for it. Maybe you ought to find out who is.
Who is this guy?
The fact that you celebrate this freeze, do you think that was a good idea to put all of this on
Who
hold?
are these guys?
Funding and any kind of further work? NIH research?
Let me find out. Hold up, bro. Who are my?
Pointed
What do
out.
you, I'm not asking for, I love Mike Craig. I'm asking you. You're up for a very, very important position.
As he pointed out, Senator, the,
All right,
the
let me
portals
just-
that were closed were not closed as a result of the Trump
Let me just tell you, I'd like you to
Purposeful
explain, excuse me,
policy.
sir, I'd like you to explain to a domestic violence center in Richmond that's saying because this freeze, they may have to close down, where those battered women to go. Or a rural nonprofit I've got in the Chinook Valley who's saying that freeze is going to potentially shut down their ability to operate. So I guess if you deny or don't know what your campaign's sending on, you don't know if you raised a lot of money Monday night.
Like, what is he asking?
Trump
You don't know
administration
if
has-
you raised a lot of money.
The Trump administration has made clear that it does
It's not even relevant.
these benefits
All right,
for
excuse me.
any Americans
I-
under Medicaid or Medicare, and I do not want to
There
dismantle
the
Medicaid.
freeze is
Either.
affecting beyond Medicare and Social Security. I would hope you would have known that, be able to answer some of this. Now, you've said publicly, you want to immediately get rid of 600 NIH workers on job one, on day one. When we had our meeting, you said you'd actually like to get rid of 2,200 people from HHS. Which offices are you going to start cutting and riffing these 2,200 workers from?
Senator, there's 200 political appointees that are changed during every administration.
So if you got rid of those 200 political appointees, you're not going to replace them with your political appointees.
Well, President Biden this year changed 3,000 employees at HHS. 3,750
So
at NIH.
your 2,200, what departments are you going to pick them from?
Well, the same as
Like,
President
what the
Biden
fuck?
did when he changed 3,000 out. They're
Let me
from all
just,
across all
I'm down to
This
a minute.
isn't a gotcha,
The
bro.
chairman's been generous with colleagues on both sides. I may have to go a couple minutes over.
Congress
Let me just
pisses
say-
me off,
let me
man.
just answer. This would be, I hope, since you're asking to become the top healthcare official in the United States in terms of HHS, huge ramifications, and part of this job is to be the senior advisor to the president on health issues. So when we're looking at this purge and we're looking at laying off workers, when we're looking at potentially the president's illegal offer to try to buy out federal employees, which I would say to any federal employees, think twice. Has this individual in his business world ever fulfilled his contracts or obligations to any workers in the past?
What's
But
he
if you
talking
are
about?
in this position, will you pledge that you will not fire federal employees who work on food safety, work on trying to preventing things like salmonella?
What the fuck is this nigga
Senator,
talking about?
91,000 employees.
So that I take that as I take it. That's a simple yes. I'm going
You
to take
think
that as
I
a
could
no.
run that
I
agency
take that
without
as a no.
getting rid of some-
Will you actually? We talked about protecting Americans.
And what
from
pisses
cybercrime.
me off is here we got this guy, Mr. Warner. And we're gonna search him. We'll do some research. I can't find him right now. But here we got this guy making 250,000 plus. And he's like, gotcha. But this is no fucking gotcha, dumbass. Our food is poisonous. We know that. Oh, but here you said, like, what? These niggas kill me, bro. I'm not gonna lie. It's a dirty, dirty game. And I'm about to get dirty. We all gonna be dirty at it. We all gonna be
Games
dirty.
on vaccines will be out of
If we
order.
gonna be dirty, then we
Will
gonna all
you
be dirty.
Freeze grant funding for community health centers. Will you freeze federal funds for community health centers the way the current administration is?
The White House has made clear And no funds are going to be denied to any American for benefits
Listen,
in any program.
Do you know what happens at community health centers? Those are direct.
Are you talking about the Indian health centers?
No, I'm talking about community health centers across the country.
I understand that.
Community health.
I strongly
So you're going to
support-
excuse Indian health centers, which is good, but others are not. They're going to get their funds frozen.
I strongly support
the hell?
community health centers, as does the president. He
So does that mean you're not going to freeze the funding that is currently frozen?
The White House
Won't
has made
unfreeze it?
clear that none of that funding is supposed to be frozen.
Sir, the direct payments are different than how the government operates. We fund the federal government down to community health centers. As a former governor, there's lots and lots of state programs that are related to health care that come from the federal government, they come down to the state, then it goes to local programs. All of those don't directly pay out $1 at a time, but they come from federal funding. They are all, even though they keep changing the guidance on a minute-by-minute basis, based upon 9:45 or 10:30 or 10:45, whatever time it is today, those funds are still frozen. Sir, I just honestly, I want to give you a fair shot, but I don't feel like you approach this job with the knowledge and candidly your willingness not to
Okay.
commit.
And 10,000. Hey,
Try to recommend to the president
Hey.
to make sure these funds
and all 10,600 of us just seen you.
is a very disappointing answer. Thank you, Mr. Chairman.
So thank you. Thank you.
Senator
We'll keep an eye
Langford.
on you, buddy.
Chairman,
We'll
thank
keep
you.
an eye on you, buddy, Mr.
Kennedy,
Warren.
it's good to see you again.
I will
We
not
had some
forget
great
you.
visits in my office. We've done some follow-up calls.
We will not
We've
forget
gone
you.
through- You and I have talked about 100 different issues and backgrounds and things. You've been able to address a lot of them today and just different questions to be able to clear up social media rumors and the things.
Now, here's a guy we can research.
We've talked about farms.
Here's a guy we can research. Warner is too public. Warner, that'd take too long. We can Langford, we can find his ass.
Commercial and row crop agriculture. We've talked about food issues, and you made it very, very clear. You're not going to tell Americans what to eat, but you do want Americans to know.
Oh, he's
what
good.
they're
He's
eating.
on the good side.
I think that's a pretty fair perspective.
He's on the good side.
I do want to talk to you about some areas that you and I have talked about as well. We have some disagreements, you and I, on the issue of life and when life begins on that. You've been very outspoken on that, and we've had some good opportunities to be able to talk about that. Title 10 is specifically in the HHS area. This has been an area that has been interpreted for a long time, and President Trump in the first administration interpreted that rule to say that his administration will prohibit the performance, referral for, or promotion of abortion as a part of the Title 10 program. That he made that very clear in the first administration. Obviously, that's his decision to make again on that, on how he wants to handle that, and he's made a lot of public statements on that. The Biden administration not only reversed that, not only rescinded that rule, but they went one step the other direction. In my state in Oklahoma, as you and I have talked about, the Biden administration cut off funding to the state of Oklahoma for AIDS testing, for breast cancer screening,
Here, I'll make a
and
tweet.
for other
If
areas
nobody else wants to
of
make a tweet, I'll
poverty
make a tweet.
healthcare, because my state didn't promote abortion. It wouldn't provide. If my state wouldn't promote abortion in the state, we got cut off for federal funds for AIDS testing and for other things. My simple question to you is, how are you going to handle Title 10 on that? I saw how President Biden handled that in the punitive measures that came on my state for those that are in rural health care. How are you going to handle Title 10?
I'm going to support President Trump's policies on Title 10. I agree with President Trump that every abortion is a tragedy. I agree with him that we cannot be a moral nation if we have 1.2 million abortions a year. I agree with him that the states should control abortion. President Trump has told me that he wants to end late-term abortions, and he wants to protect conscious exemptions, and that he wants to end federal funding for abortions here or abroad. That's Title 10. I serve at the pleasure of the president. I'm going to implement his policies.
Thank you for that. President Biden, when he came in, immediately closed down the Office of Civil Rights and Conscience Protections within HHS. There's a statement that's come out recently that he's going to reopen that office again to be able to protect the civil rights of Americans. One of the things that Javier Becerra did immediately when he came into HHS was conscience protections for medical professionals that were being compelled against their conscience to perform medical procedures that violated their conscience. Javier Becerra stepped in immediately into HHS and withdrew that and said, no, the federal government will tell you what you believe about these issues. You don't have conscience protections anymore, and refused to protect those folks. will you step in and say that healthcare individuals have the right of conscience again, as the federal law allows?
Yeah, I mean, the first thing that occurs to me when you ask that question is what patient would want somebody doing a surgery on them that, believes that the surgery is against their conscience being forced to perform that. I don't know anybody who would want to have a doctor performing a surgery that the doctor is morally opposed to. Listen, I came from a family that was split on life and choice. I have cousins today who believe that abortion at any stage is equivalent to homicide. Now, there are other people who believe the opposite.
Oh, window don't fucking stay up, man.
The good thing in my family that I really loved is that we were able to have those conversations and respect each other. And I wish that we could do that nationally. And if forcing somebody to participate in a medical procedure as a provider that they believe is murder does not make any sense to me. We need to welcome diversity in this country. We need to respect diversity. And we need to respect each other when we have different opinions and not force our opinions on other people.
Yeah, thank you for that. The FDA, under the Biden administration, changed the rules for the chemical abortion drug and said you no longer need to see a physician. So if you have an ectopic pregnancy or all kinds of don't even go anymore to see a physician. But they also changed an area that has been something that's been very particular. You've talked about a lot, and that's transparency. They changed the position and said, don't tell us if there's a side effect on this drug unless she dies. But other than that, don't tell us anymore. Literally, don't give transparent information to the American people or to the women who take this drug anymore. We don't want that reported. My question to you is, will FDA move to be able to actually give transparency to the American people and to say, this drug is no different than any other drug. We're not going to protect it just because it's political for some folks. People should know side effects on this drug, and there should be reporting.
Yeah, I mean, it's against everything we believe in this country that patients or doctors should not be reporting adverse events. We need to know what adverse events are. We need to understand the safety of every drug, mifepristone, and every other drug. And President Trump has made it clear to me that one of the things he is not taking a position yet on mifepristone, a detailed position, but he's made it clear to me that he wants me to look at the safety issues. And I'll ask NIH and FDA to do that.
Thank you.
Senator Whitehouse.
Thank you, Chairman. Mr. Kennedy, I only have 5 minutes with you, and I've got a lot of experience with CMS, so you're just going to have to listen. 2 things. One, if you want to move from advocacy to public responsibility, Americans are going to need to hear a clear and trustworthy recantation of what you have said on vaccinations, including a promise from you never.
He doesn't owe you shit. And what kills me is these, I don't know if you want to call them Democrats. I don't know who this guy is, right? Mr. Whitehouse. What the fuck kind of name is that, right? I don't know who these guys are, but they make it seem like they've had our best interests. They've never had our best interests. Never. That's why we're in this situation. You don't care about what there is. We're putting RFK in office so we can get transparency. You never cared about the American public, or else we wouldn't be in this. Like, this should be a no-brainer. It should be a no-brainer. Unless you're taking 500,000, which a lot of them are, from Big Pharma, this is a no-brainer.
Than neighboring Massachusetts and Connecticut providers. A differential of 23 and 26.
So he don't have to tell you shit about no vaccines.
In our regional healthcare market. The Pending Ahead program can begin to remedy this, at least for value-based care, and it must. There has to be payment parity in the region. Rhode Island's healthcare system is bleeding out because we aren't paid what neighboring hospitals and doctors are paid. And the one act CMS took on this years ago was to make it worse. The CMS bureaucracy has also attacked one of the best accountable care organizations in the country, Rhode Island's Integra Family Doctors. Tried to throw them off the shared savings program because they said Integra years ago briefly fell 137 patients short of the 5,000 patients that ACOs need. CMS wouldn't listen until a court found that to be unjustified, likely illegal, irreparable harm to this high-performing ACO and its patients, and contrary to the public interest. That must stop.
You don't have our interest.
Last, CMS has refused to approve waivers granted elsewhere for Rhode Island from rules that are stupid for Medicare patients who are nearing the end of their days. Here's what families see. Granny is home dying. She needs to transfer to a nursing home, and Medicare insists on putting her 3 days and 2 nights in a hospital. Expensive, frightening to Granny and the family, and stupid. Granny's home dying and can't get palliative and curative care together. Inhumane and stupid. Granny's home dying and can't get home care if she can still get out into the yard or be driven to see the shore, to see Narragansett Beach, say, one more time, to recall childhood memories before she
The
dies.
fuck is he even talking about?
And stupid. Granny's home dying and the family's exhausted. And the respite care benefit is not to send a nurse or a caregiver, but to stuff Granny in an ambulance and haul her off to a hospital. Some respite. It's all expensive, frightening, inhumane, and stupid. But the insensate CMS bureaucracy takes a court order to be awakened to the harm they cause. I have had enough. CMS should let Rhode Island try humane end-of-life care through CMMI. Let's see if it works at a state.
What the hell is this
I bet
nigga?
it
Is
will
he
save
trying to?
money, serve families better at a very
What is he? Is he trying to promote his own business? I have no idea what this nigga's talking about.
for better health care everywhere. I've said a lot. My time is out. You're welcome to respond in writing. I ask unanimous consent that the order declaring CMS's actions to constitute irreparable and illegal harm be put into the record.
Without objection.
Let me just respond very briefly. Senator Whitehouse, I'm an implacable enemy of tyrannical, insensate bureaucracies and stupid rules, and I will work with you to make CMS responsive to the needs of Rhode Island and to remedy those disparities that you talk about. I am familiar with the Integra Health plan, and it is the template for what we ought to be doing. It's a value-based plan, and I look forward to you to making sure that we create pilot programs like this.
Unfortunately,
that can be
Mr.
then
Chairman,
reproduced around the country.
Unfortunately, Mr. Chairman, one of the things I've learned in my tenure in the Senate is that a nominee saying that they're willing to work with me amounts to exactly zero. We need to get this fixed. Thank you.
Well, I guess at that point then we will move on to Senator Daines.
Mr. Chairman, thank you. Mr. Kennedy, I'm glad to see you here this morning. I listened to your opening remarks, and you mentioned that you want to make HHS the gold standard of science. I have found my engagements with you, both behind closed doors in my office, as well as listening to you publicly, be very thoughtful and science-based. I applaud that. I thank you for that. And I realize this will likely be a very partisan vote on this committee and on the Senate floor. But let the record state there are 3 medical doctors on this side of the dais. I'm a chemical engineer. We believe in science. I'm thankful that you do too, and you made that comment in your opening remarks. I want to talk about agriculture for a moment. We talked about our common love for Montana. You've been to Montana many times. It's a wonderful state. A lot of folks have discovered it. They watch the show Yellowstone, and people are coming and moving into our state. But it's an amazing place. But as you know, agriculture is our top economic driver in Montana. We produce some of the highest quality crops, the best livestock in the country and the world. Our farmers and our ranchers are truly some of the most effective environmental stewards in ensuring we have a safe food supply chain in the world. I share your view that protecting the integrity and safety of our food supply is of utmost importance. I appreciate the research happening in places like Montana State University to help farmers produce resilient, healthy, and safe crops, as well as their agricultural practices. You mentioned you were a 4-H kid growing up. I think our 4-H kids and our FFA kids are some of the best kids in America. My question for you, Mr. Kennedy, is if confirmed, as I'm listening to my farmers and ranchers talk about the future, will you commit to working collaboratively with partners at USDA, at the relevant federal agencies, as well as our Montana farmers and ranchers, before implementing any policy that might affect or impact food supply?
I absolutely will make that commitment. I have, as I shared with you, a personal commitment and a long career working with farmers. I want to make sure I understand the very, very narrow margins, the slim margins that American farmers and ranchers are dealing with. And I don't want, under my watch, a single farmer to have to leave his farm for economic reasons or for regulatory or bureaucratic reasons while I serve, if I'm privileged to serve, and to be confirmed as HHS Secretary. Even more important, President Trump has a very, very strong commitment to farmers. President Trump is probably historically in modern history the best farm president in our history. Farm income spiked for the first time in decades under his last administration. He got solid support from farmers across the country. Farm country is Trump country. Farmers across the country supported him during this election. He has specifically instructed me, and he wants farmers involved in every policy, and that he wants me to work with Brooke Rollins at USDA.
You see that 11.9 thousand people? That's Maha. That's Maha. That's independent voters. That's independent media.
Having you and Brooke Rollins out to Montana. Spend some time with
you have my commitment to come there anytime, particularly during ski season or hunting season.
Deal. I want to shift gears for a moment. As we discussed in the meeting we had in my office, mifepristone was approved in 2000. The FDA has been under scrutiny and brought to court for failure to properly assess this drug, as well as subsequent deregulations Senator Langford described that have occurred over the past 25 years. Some of these deregulations included ending the requirement that these drugs be prescribed by a doctor, ending reporting requirements for adverse events, and allowing these pills to be obtained through the mail. In fact, the FDA's own prescribing label mentioned that 3 to 5% of women taking this drug end up in the emergency room. My question is, if confirmed as Secretary of HHS, will you commit to working with the FDA Commission to review these deregulatory actions that are threatening the safety of women?
What do you say?
Sorry, Senator. As I said to Senator Langford, I think it's immoral to have a policy where patients are not allowed to report adverse events and where doctors are discouraged from doing that.
Oh yeah.
Has asked me to study the safety of mifepristone.
This is the first guy. This is the first guy. This is the first guy, right? Right? That's Mr. Wyden, right? I think that was the first guy we listened to. $740,000 in donations from big pharma, lobbyists, etc. 700,000. So they never had our best interest. Stop acting like you did. And who is this bitch? She better not piss me off either.
Expansion, then went back to work, and now they're on private insurance. So those are some facts about Medicaid.
Just out of touch. Out of touch. And quite frankly, out of pocket, if you ask me. Out of pocket, if you ask me. All of them are out of touch.
Vaccines are one of our greatest public health triumphs. And you don't need, I'm not talking about abstract medical science. One of the people who helped raise me was my grandfather, who was a pediatrician. He practiced medicine in this country from 1921 until the mid-1980s. And I heard details about the difference those vaccines made in saving lives in the children who were under his care. Vaccination has helped to eradicate many deadly diseases in the United States, including polio and smallpox, something we should be proud of as Americans. I am extremely concerned that as Secretary, you would be able to halt critical vaccine research and to exploit parents' natural worries by advising them not to vaccinate their children. This will lead to more children getting sick, and some will even die. Before the measles vaccine, about 500 American children died a year from measles. This is too much of a risk for our country.
Look, they scared to show us. Pull it up, pull it up, pull it up. We already know she's getting paid off. We already know that.
Views that you have promoted for 25 years. For example, you have previously falsely suggested that the polio vaccine killed many more people than polio ever did by causing fatal cancers, while rigorous safety studies show that to be completely false. Now, let's go to something we agree upon. I am really heartened to see that one area where we agree on is on women's reproductive freedom. In your own words, it's not the government's place to tell people what to do with their bodies. You said that, correct? Yep. Mr. Kennedy in 2023.
See, where is she getting this money from, though?
And said, quote, I'm pro-choice.
Other committee contributions, like other committee, like where is she getting the money from?
Or cannot do with their body. So you said that, right?
Yes.
Yep. But you also said we need to trust the women to make that choice because I don't trust government to make any choices. You said that too, right?
Yes.
It is remarkable that you have such a long record of fighting for women's reproductive freedom, and really great that my Republican colleagues are so open to voting for a pro-choice HHS secretary. So, Mr. Kennedy, I'm confused. You have clearly stated in the past that bodily autonomy is one of your core values. The question is, do you stand for that value or not? When was it that you decided to sell out the values you've had your whole life in order to be given power by President Trump?
Senator,
Like, what?
President Trump, that every-
What the hell is she talking about?
We can't be a moral authority in this country.
Right, so, but that isn't what you said back in New Hampshire in 2023. My question is exactly when did you decide to sell out your life's work and values to get this position?
Senator, I agree with President Trump that every abortion is a tragedy.
So what you're telling us, just to be clear, because my time is limited, is that regardless of what you believe, regardless
Okay,
of
hold
what
on, we
values
getting
you
somewhere.
have, if President Trump tells you to do something, you're going to do it. You said
Retired.
the discussion about mifepristone. Oh, he's asked me to study the safety of it.
Top industry.
Here are the safety studies that tell us mifepristone
Top
is
contributor.
safe
Emily's
and effective.
list.
And I asked
What the
Mr.
hell is
Chair,
Emily's
that
list?
means about 40 studies be admitted to the record by unanimous consent.
Without objection.
What is Emily's
So,
list?
The studies are there. The safety is proved. The
J
science
Street
is
Pack.
there. But what you're telling us is if
So what we're looking at, Google J Street Pack, Emily's list, right? Google J Street Pack, Microsoft Corp, MGM Resorts. That's a fucking betting casino, right? So she's taking money from betting casinos, tech, Emily's list, whatever Emily's list is. I have no idea what that is, right? She took 1 million, it looks like, from health professionals. Am I tripping? Right? She's taking a lot of money from PACs, is what you need to know. And somebody else is going to dig deeper. Somebody else is going to dig deeper, but y'all get the point.
issued that statement only after we pointed out the damage it would do, and it became politically uncomfortable.
Well, that's Miss
You know what
Hassan.
else
That's Miss Hassan.
Freeze on federal funding did? It halted funds
Miss Hassan.
for
No.
critical research that could cure pediatric cancer. So if the president tells you to do that, you're going to stop that too. That's enough.
Thank you. Senator Cortez Masto is next.
We already did Cortez.
Thank you.
We already did Cortez. I think we're on this bitch. Emily's list. What is Emily's list? Harvard University. Why are you taking money from Harvard? Women's issues. I think this bitch is even worse. Huh. Carter Blackie said, "Hey, how are you? How are you today? I'm sorry, I'm having trouble with headphones. If it's possible for you to type for me, please." I'm having trouble with my loading. You having trouble with your headphones? I'm having trouble with it loading. Hold on. Let's find that link again. Look at this. I mean, the corruption runs deep. I don't know if I could type it. Let's see. Type what? What do you want me to type, bro? How can he not hear me? Follow me. Carter Blackie. Who is that? Where do you come from, Carter? I'll say what's up. Oh, my fucking God. Let me see what I could do. Hold on, let me pull this back up. 1 minute, though, Carter. The man can't hear me, he says. That's no good, right? Let's go back to this hearing live, and then maybe we can find a way to type to Carter. I don't know.
Yeah,
In this case, let me
Look.
I appreciate that.
Look.
But what authority do you have over this?
Look.
What authority do I have?
Yeah, to enforce the law,
In what regards?
to make sure that a hospital that receives payment from Medicare is ensuring that they're providing the necessary emergency care to patients.
Look. They get real defensive. They get real angry when you threaten their pockets and you threaten their donations. That kind of pisses them off, right? If you're getting $200,000 every other month or so, and you got a nigga that's about to end that, you're not gonna like that guy that much. And that's what you see here. We already went through Cortez. We already went through Hassan. I mean, these guys are taking hundreds of thousands of dollars from people that they shouldn't be taking it from. Now let's see if we can do something for Carter. You still can't hear me? Carter, do I know you or no? Let's see if we can do something for Carter. You can't hear me. Let's see. I think we could do like this for Carter. Right? Right?
Secretary to examine ways to reduce drug prices and improve access to innovative therapies for the American people. And unfortunately, Republicans in Congress want to repeal the Inflation Reduction Act, which means reversing all of those things that we worked on to lower prices for Americans. So my question to you is, what do you do? Why are you there? Are you there to be a rubber stamp to this administration and cave into all of these positions that they're taking, even though you know they're in disagreement with your positions on lowering drug prices and that they could harm Americans? How do you handle that as HHS director?
Senator, my understanding is that the White House issued an executive order, I believe today, supporting the drug negotiations under the IRA. President Trump was very aggressive during his first term about negotiating drug prices. He has instructed me, and I've met with him repeatedly on as that we need lower prices than seniors in this country, and
so let me ask you. Let me ask you this, because I only have so much time. So we've already negotiated lowering prices for 10 drugs with Big Pharma. And Big
That's not enough.
Opposes this. They have not only are asking for a pause, they have filed lawsuits, but we've already negotiated the first 10 drugs.
Okay, cool.
And we want to expand it to the next 10 to 15 that the Biden administration has put forward. Would you agree and continue that path?
No.
Of really mandating that Big Pharma come to the table and negotiate drug prices for Medicare so we can lower prices for Americans?
my understanding is that the executive order that was issued today, which I haven't
We don't care about Big Pharma.
Well, let me ask you this then, because you keep citing the Trump administration and you're just going to follow what they say. Is that what you're doing? You're just a rubber stamp for them in this position? So anybody, so it doesn't matter that you're before us. It could be anybody coming before us as long as they're a rubber stamp for this administration and disregarding your beliefs and what.
Who is this bitch?
I guess my question to you is, if it really is fundamental to what you believe, how do you live with that? How do you address those issues as you're moving forward?
You want me to
Who is this bitch? I guarantee.
You want me to answer the question?
No, I'm asking you.
Okay. President Trump has asked me to end the chronic disease epidemic and make America healthy again.
The only reason why you're at HHS? Is that the only reason why then you're at the HHS?
Yes!
President Trump has asked me because I'm in a unique position to end that. And that is what I'm doing. And if we don't solve that problem, Senator, all of the other disputes we have about who's paying and whether it's insurance companies, whether it's
No, just because you get
whether it's patients or families, all of those are moving deck chairs around on the Titanic. Our ship is sinking. Our 60% increase in Medicaid over the past 4 years is the biggest budget line now, and it's growing faster than any other. And no other nation in the world has what we have here. No other nation has a chronic disease. We have the highest chronic disease burden of any country in the world. We had, during COVID, we had 16% of the COVID deaths in a country. We only have 4.2% of the world's population. We had a higher death count than any country in the world. And when CDC was asked why, they said it's because Americans are the sickest people on earth. The average person who died from COVID, American, had 3.8 chronic diseases. This is an existential threat economically to our military, to our health, to our sense of well-being. And it is a priority.
You don't cut off RFK. When RFK talking, you let him talk.
Asked me to run the agency, and if I'm privileged to be confirmed, that's exactly what I'll do.
Yeah, get out of here.
Senator,
Get out of here, bitch.
Thanks so much, Mr. Chairman. Mr. Kennedy, thank you for taking time to visit with me.
All these little Democrats and like they're just holding on. They're holding on to their last little sliver of power. They're holding on to that last little sliver of power.
challenges that healthcare providers and
So you
patients
better
are
vote for him if you know what's good for you.
financial obstacles facing rural hospitals.
You better vote for him if you know what's good for you, because we got 13.2 thousand people.
New regulations that are painful that have come out of the
I tell you, man,
administration
try
affecting
us.
our ability to provide
Try us.
nursing home staff.
Try us.
So let me start, if I could, with rural hospitals.
And you won't.
the
How about this?
closures
I tell you
of
this.
Hospitals like that.
You won't win your next reelection.
There are a lot of challenges facing hospitals.
If you do not confirm that, man, you will not win your next reelection. So I'm talking to you, Elizabeth Warren. I'm talking to you, Cortez and Hanan, or whatever your fucking name was.
Weather impacts them. 6 of the hospitals are at
This
risk
shit is-
of closing. 2 are at immediate risk of closing in the next 2 years. 10 have had to cut available services. And this is a concern of rural hospitals in both Republican and Democrat states. Either way, bipartisan. Critical that the workforce challenges, financial challenges that we're facing are addressed. Can you commit to working with us on a plan to address the critical nationwide issue of rural health care?
Yes, Senator. And I would say that during my visits, I visited almost 60 senators so far. And the most common unifying, I would say, issue among both Democrats and Republicans, there were 2. One was PBM reform, and the other is rural hospitals. And, our nation made a commitment over 100 years ago to put a hospital within 30 miles of every American. We generally succeeded in doing that. It's absolutely critical. It's life-saving. And rural hospitals are closing at an extraordinary rate right now. They not only provide important health care for the localities, but also they're economic drivers for localities all over this country. President Trump is determined to end the hemorrhage of rural hospitals, and he's asked me to do that through use of AI, through telemedicine, which these are innovations that I saw the other day. A Cleveland clinic has developed an AI nurse that you cannot distinguish from a human being, that has diagnostics as good as any doctor. And we can provide concierge care to every American in this country, even those the remote parts of Wyoming, Montana, Alaska, etc. We also have opportunities at HRSA and at the GME to finally live up to GME's mission of providing personnel to rural hospitals. And I intend to use all of my power, because I've seen the priority that it's given by both Democrats and Republicans on this committee. I intend to make that a priority if I'm privileged to be confirmed.
Well, I appreciate it, because often with financial strains on a local hospital, one of the common services to be cut in rural hospitals is maternity services. So now we have women in Wyoming having to drive over 100 miles to access care. 13 counties in Wyoming don't have access to OB, and we're talking counties larger than the states of Vermont, New Hampshire, Rhode Island, Connecticut, New Jersey, Delaware, counties larger than those whole states. So will you commit to working with my office to find solutions to help address these specific maternal health challenges in rural America?
Yes, Senator, I look forward to it.
Another issue we specifically spoke about was this harmful Biden administration rule that have really been bad for our rural nursing homes. And it's a rule that would triple the registered nurse requirements in nursing homes. This is going to lead, there just aren't enough registered nurses in our state to be able to comply with this. This would lead to nursing home closures across our state. Will you commit to working with me to fix this serious problem that it was a result of a rule that came out by the Biden administration, who clearly doesn't understand rural America?
Yes, Senator, I think the rule was well-intentioned. But as you've said, and I've heard from many rural senators, it will be a disaster for their states. Some of the nursing homes, these are staffing rules that require 24-hour staffing by medical professionals. Some of the nursing homes in rural areas simply do not have the available personnel or the economics to be able to do that. It will mean the closure of nursing homes in rural areas across our country, which means the parents, elderly parent, will be moved a great distance from the local community and their family. And we know that the single greatest driver of high-quality nursing home care is the involvement, the proximity of family members. When you move that nursing facility away from the community where the kids live, you're going to get much worse care. So the intention, although it was noble, was in reality, for rural areas at least, it is going to be a disaster.
Thank you, Mr. Chairman.
Thank you. Senator Johnson.
Mr. Kennedy, welcome. Thank you for being here. Thank you for your decades-long advocacy for a clean environment, for children's health. I can't say as I'm surprised by the hostility on the other side. I'm highly disappointed in it.
Yeah.
I don't know if you remember when you called me up and you were contemplating setting your political differences aside.
Yeah.
Joining forces.
It disappoints me too.
On an area of agreement.
It disappoints me too.
Addressing chronic illness, trying to find the root cause of all these problems facing this nation. My first response was, Bobby, this is an answer to my prayers. We need to get to the answers of this, but even more, we need to heal and unify this divided nation. I'm not necessarily the most optimistic guy because we've got enormous challenges facing this nation, but I thought, wow, here's somebody from the left, somebody I don't agree with on many issues politically, coming together with President Trump and focusing on an area of agreement, something that the American people desperately want.
That's why there's 13.6 thousand people watching this. Because it's what the American people want.
Ms. Kennedy, I think I've come to know what's in your heart.
And that's just on X. That's not even including like Fox and...
I want to say publicly, I thank you for that. I truly appreciate what you're doing here.
Me too. Me too.
Can't we come together as a nation and do this? Can we do? Aren't you getting tired of this? I'm getting tired of this. So again, Ms. Kennedy, I need to enter in the record. These are just 11 letters of support signed by 63,000 people, thousands of doctors. From the American Association of American Physicians and Surgeons, Independent Medical Alliance, the North Carolina Physicians and Freedom Group, Governor Jeff Landry from Louisiana. These are Americans, nonpartisan. A lot of these people I know because I've advocated with you. A lot of them are Democrats. They put their political differences aside. So, Mr. Chairman, I'd like to enter this in the record.
Without objection.
I also do want to, Mr. Kennedy, as long as I have you here, I've written over 70 oversight letters to the federal health agencies under the Biden administration. I've virtually gotten squat out of them, okay? What I get is we get, for example, 50 pages of Anthony Fauci's emails redacted. Oh, by the way, the latest one was 17
redacted.
pages.
50 pages
redacted.
redacted.
Alert on the myocarditis they knew was impacting young men early in 2021. Instead of issuing an alert on the Health Alert Network, they developed 17 pages of talking points. This was given to the public under a FOIA request. They had to go to court. They've got a new way of redacting. They don't black things out. They just give you white pages, so you don't even know what they have redacted. So again, I've issued a subpoena now to cover the information I've requested in 70 oversight letters. My question
And
to you
all we're
is,
asking for is transparency.
as Secretary of HHS, will you honor these requests from Congress, and will you make HHS transparent?
Yes.
Yeah, my approach to HHS, as I said before, Senator, is radical transparency. Democrats,
Radical transparency.
They want to come in.
That's what we're asking for.
Information that will
Radical
generate
transparency.
Taxpayer expense that is owned by the American taxpayer. They shouldn't get redacted documents. Public health agencies should be transparent. And if we want Americans to restore trust in the public health agencies, we need transparency. I want to say something about what you first said. When I launched my campaign, it was about uniting Americans, Democrats and Republicans. There's no issue that should unite us more than this chronic health epidemic. There's no such thing as Republican children or Democratic children. These are our kids. 66% of them are damaged. I know what a healthy kid looks like because I had so many of them in my family. I didn't know anybody with a food allergy growing up, peanut allergy. Why do 5 of my kids have allergies? Why are we seeing these explosions in diabetes, rheumatoid arthritis, neurological diseases, depression,
Autism,
all these things that are related to
obesity.
toxicity and growth?
I can say I know a couple too.
Agree with each other.
All right.
To put differences about so many issues, intractable issues aside, and say we're going to end this. I don't think anybody is going to be able to do this like.
And then,
because of my peculiar experience, because I've litigated against these agencies. When you litigate against them, you get a PhD in corporate capture.
You get a PhD in corporate capture. I like when he says that.
6 books about these agencies. I know a lot about them, and I know how to fix it. And there's nobody who will fix it the way that I do, because I'm not scared of vested interest. I don't care. I'm not here because I want a position or a job. I have a very good life and a happy family. This is something I don't need. I want to do this because we're going to fix it. And the other thing is, we are attracting now a caliber of people to HHS like never before in history. And they're entrepreneurs, they're disruptors, they're innovators of immense talent that are walking away, many of them, from growing concerns. They're not coming there for position. They're coming there because they want to save our country. And they're from across the political spectrum.
He's gonna get an audition. He's gonna get an applaud after this.
For partisan issues, they used to be my friends. They agreed with me on all the environmental issues that I've been working on for my whole career.
But now they don't.
Now they're against me because anything that President Trump does, any decision he makes, has to be
political,
lampooned, derided, discredited, marginalized, vilified.
Vilify it. It's not that deep.
Thank you, Mr. Chairman. So, Mr. Kennedy, I want to start.
The nigga said, I'm not scared of vested interests. Right? Who are you talking about? The people that's... So, a lot of these senators are bought and paid for. Oh my God, this bitch. I can't wait to hear this bitch.
You said that you will, quote, slam shut the revolving
I can't wait to hear this bitch.
Between government agencies and the company.
Elizabeth Warren.
That also sounds great. So here's an easy
500,000 plus in pharmaceutical donations to her campaign. Even more than that. It's far more than that.
A hospital system or a health insurer for at least 4 years, including as a lobbyist or a board member.
Can you just repeat the last part of the question?
Oh, this bitch.
You're not going to take money from drug companies in any way, shape, or form.
Me?
Yes, you.
Oh. I'm happy to commit to that.
Okay, good. That's what I figured. I said it's an easy question to start with. And I think you're right on this question.
I don't think any of them want to give me money, by the way.
Let's keep going. You're right because to say yes, because every American has the right to know that every decision you make as our number one health officer is to help them and not to make money for yourself in the future. So I want to talk more
That's what
about
you're doing.
money. I'm looking at your paperwork right now. In the past 2 years, you've raked in $2.5 million from a law firm called Wisner Baum. You go online, you do commercials to encourage people to sign up with Wisner Baum to join lawsuits against vaccine makers. And for everyone who signs up, you personally get paid. And if they win their case, you get 10% of what they win. So if you bring in somebody who gets $10 million, you walk away with $1 million. Now, you just said that you want the American people to know you can't be bought. Your decisions won't depend on how much money you could make in the future. You won't go to work for a drug company after you leave HHS. But you and I both know there's another way to make money. So, Mr. Kennedy,
what's your question?
will you also agree that you won't take any compensation from any lawsuits against drug companies?
Yes, he will.
While you are secretary and for 4 years
He can do that if he
afterwards.
wants. He could do that if he wants. I wouldn't give a
I'll
fuck.
certainly commit
I wouldn't care if he
to
did.
that while I'm secretary. But I do want to clarify something because you're making me sound like a shill. I put
You're the
together
one who
that
got-
case. I did the Science Day presentation to the judge on that case to get it into court.
Mr.
The Daubert
Kennedy,
hearing.
Mr. Kennedy, it's just a really simple question.
Yeah,
You've taken in $2.5 million. I want to know if you will commit right now that not only will you not go to work for drug companies, you won't go to work suing the drug companies and taking your rake out of that while you're secretary and for 4 years after. It's just
I'll commit to not taking any fees from drug companies while I'm secretary.
No. I'm asking about fees from suing drug companies. Will you agree not to do that?
You're asking me to not sue drug companies,
No,
and I'm
you
not
can
going to
sue
agree to that,
drug
Senator.
companies as much
I'm
as you want.
Yeah!
I'm not going to agree to sue drug companies. All
The
right.
people is up, bro.
Let's do a quick
The
count
people,
here.
your game is up.
How, as
Your game is
secretary
up.
of HHS, if you get confirmed, you could
Your game is
influence
up.
every one of those lawsuits. Well, let me start the list. You could publish your anti-vaccine conspiracies, but this time on U.S. government letterhead, something a jury might be impressed by. You could appoint
I
people
don't
to
understand
the
that.
CDC vaccine panel who share your anti-vax views and let them do your dirty work. You could tell the CDC vaccine panel to remove a particular vaccine from the vaccine schedule. You could remove vaccines from special compensation programs, which would open up manufacturers to mass torts. You could make more injuries eligible for compensation even if there is no causal evidence. You could change vaccine court processes to make it easier to bring junk lawsuits. You could turn over FDA data to your friends at the law firm and they could use it however it benefited them. You could change vaccine labeling. You could change vaccine information rules. You could change which claims are compensated in the vaccine injury compensation program. There's a lot of ways that you can influence those future lawsuits and pending lawsuits while you are Secretary of HHS. And I'm asking you to commit right now that you will not take a financial stake in every one of those lawsuits. So
No.
what you do as secretary
It's his lawsuits.
will also benefit you financially down the line.
I'll comply with all the ethical guidelines.
That's not the question. You and I, you have said
You're asking me.
You're asking him not to sue.
Not to sue vaccine
No,
pharmaceutical
I am
companies.
not.
Yes, you
Yeah,
are.
you are.
Yes, you are.
That's what you're doing.
No, look, no one should be fooled here. As
Yeah, you're trying to fool us.
Secretary of HHS,
You can't fool me, bitch.
Robert Kennedy will have the power to undercut vaccines.
Confirm this nigga. Hurry up, bro. They can't confirm me
me
fast enough.
And for all of his talk,
They can't
about
confirm me
follow
fast
the
enough.
Science and his promise that he won't interfere with those of us who want to vaccinate his kids, the bottom line is the same. Kennedy can kill off access to vaccines and make millions of dollars while he does it. Kids might die, but Robert Kennedy can keep cashing in.
Senator, I support vaccines. I support the childhood schedule. I will do that. The only thing I want is good science, and that's it.
How about then say you won't make money off what you do as Secretary of HHS?
No.
Before we go to Senator Tillis, I think would be important for me to make it very clear that Mr. Kennedy has gone through the same Office of Government Ethics process as every single other nominee in the Finance Committee this year and in previous administrations. In addition to listing his assets, including the items that you've identified, he has signed an ethics letter that has been reviewed by the Office of Government Ethics concerning any possible conflict in light of its functions and the nominee's proposed
She thought,
duties.
oh
And we
man.
have a letter from the Office of
She was asking him not to sue these companies, basically. She doesn't care about, she's talking about financial gain. Would you not take a cut in the lawsuit? What? No, it works hand in hand. I sue you and I get money too. It works hand in hand.
One of the entities that it would be regulating and plans to.
And she's so tight because she gets so much money from Big Pharma.
I haven't reviewed the past documentation of every other nominee's.
They're so tight because they get so much money from Big
I know that every
Pharma.
single time we get a nominee, their financial interests are attacked. That's why we have the Office of Government Ethics. That's why they've reviewed everything that's in his record, and that's why he has even, I think, and I don't know that I want to ask him to get into it, but he has listed his assets and has gone through a discussion of the responsibilities under our ethics laws and is complied with all of those requirements. Senator Tillis.
Thank you, Mr. Chairman. Mr. Kennedy, how's your morning going?
So far, so good.
Good. You came prepared. I'm glad that you did.
He's always prepared. He's always prepared.
You, I believe, addressed to my satisfaction a question about Title X and the president's priority with respect to Planned Parenthood. Can you just affirm that you are 100% behind the president's policy on Title X and the implementation?
I'm 100% behind it.
Thank you. It's amazing to me that people. Well, first off, you need to understand I was in a judiciary hearing this morning. It's very clear to me that some of these nominations are going to be shirts and skins. So no matter what you answer in the affirmative, they're going to ask you one more question so that you won't be able to answer in the affirmative. That's just the way the game that's played when we have nominees like yourself. So I think you're handling yourself well.
Very well.
I got a real quick question for you.
Very
Are you a
well.
conspiracy theorist?
That
No.
is a pejorative.
That's what they call him.
Applied to me.
That's what they call him.
Mainly to keep me from asking difficult questions of powerful interest. I was told that I was a conspiracy theorist. That label was applied to me because I said that the vaccines, the COVID vaccine, didn't prevent transmission and it wouldn't prevent infection. When the government was telling people, Americans, that it would. I was saying that because I was looking at the monkey studies in May of 2020. I was called a conspiracy. Now everybody admits it. I was called a conspiracy theorist because I said red dye caused cancer. And now
everybody know it does.
Has acknowledged that and banned it. I was called a conspiracy theorist because I said fluoride lowered IQ. Last week, JAMA published a meta-review of 87 studies saying that there's a direct inverse correlation between IQ loss.
All right, so I'm going to assume
I can go on for about a week.
Is there any one of them that you can say, you got me? That really was a conspiracy theory, or are you in a
Not
position
yet.
to submit for the record? I think it'd just be helpful for every one of these narratives for you to submit that maybe for the record. You said something about SNAP lunch. I was in the State House in North Carolina before I came here, and anytime I'd go visit an elementary school, the first thing I would do is go to the trash cans in the cafeteria. And what we have now are kids that are not eating the food because the dictates of the federal government have made it something that they don't want. But they say, well, it's a healthy alternative. It has processed materials in it, and it's not particularly attractive to them. So they throw it away. Trash cans full of food that these kids didn't eat. So then what do? They go eat snacks, or they go eat or they drink a sugared drink. The SNAP program, everything you've said about the SNAP program, I agree with. I think that we should be very, very strict about that. And it's going to make some people uncomfortable in the food manufacturing segment, produce healthy foods that we can put in the SNAP program. That's the way to address it. But we also need to look at the school health program. I was PTA president 22 years ago at my daughter's high school. And I feel like we've got these kids that need help. We've got to guide them through a process. Many of them are probably on Medicaid, and Medicaid's failing them. Everybody here says Medicaid is sacrosanct. Nobody's admitted that Medicaid is not producing positive health outcomes. Is that your problem in Medicaid right now? The program or the outcomes?
Is the outcomes. We're spending $900 billion, and our people are getting sicker every single year.
Yeah, so anybody
and President
who's
Trump wants people to have Americans to have a high-quality insurance.
Anybody who's building a case for the status quo of Medicaid is by extension saying that they're happy with the outcomes. I think it's unacceptable. I do have a question for you on Project Warp Speed. We supported the CARES Act. We had 97 people in the U.S. Senate vote for it. Everybody here. There was only one member of Congress that voted against it, I believe. And Project Warp Speed had CDC, FDA, NIH, and BARDA very much in the mix. Now, some people think that you're going to come in here and insert yourself into those agencies in a way that's never been done before. Let's say that they're a part of a future Project Warp Speed. Is it your intent to go in and do something that's never been done before, based on my staff's research, and insert yourself in a discussion that the scientists are dealing with in those different agencies?
Yeah.
No, Senator. What
Yeah,
I
we
want
are.
to do
We
is,
are.
I'm not a scientist.
We're going to come shake it up.
Power scientist.
We're going to
I wanna
shake it up.
make
He
sure
ain't going to say it.
that
Listen,
science
Bobby
is
play nice. I don't play
economic
nice.
interest.
Me and
That's good.
Nicole
I
Shanahan don't play
I'll say
nice.
about Operation Warp Speed. It was an extraordinary accomplishment, demonstration of leadership by President Trump. When he promoted Operation Warp Speed, he was looking at all of the different remedies, including vaccines,
Therapeutics, everything.
therapeutic, ivermectin, hydroxychloroquine, famotidine, even chlorine dioxide, and he was not looking at shutting down our country for the year, forcing people to wear masks for a year, forcing all social distancing that did not have any scientific basis, which Dr. Fauci has now acknowledged. He said we took it out of thin air. But all of those changed during the Biden administration. And it became very narrowly focused. We ended up with the worst, the highest death count of any country in the world.
Mr. Chair, if I can just ask one final question, and I think it's a one-word answer. I've heard a lot of people complaining about health care delivery, Medicaid. On the other side of the dais here, who's been responsible for health care policies over the last 4 years?
The Biden.
I mean, the president, the Biden. Okay.
Yeah.
So that I'd like to have heard more of those in oversight hearings over the last 4 years. I haven't, but I'm glad that there's an acknowledgement that you're inheriting a problem that needs to be fixed. Thank you.
Thank you, Senator.
Senator Sanders.
Thank you, Mr. Chairman. Mr. Kennedy, thanks for being
Bernie, don't piss
with
me
us.
off.
I very much like the slogan that you coined, "Make America Healthy."
Bernie, don't piss me off, bro.
And I strongly
Bernie,
agree.
I like you. I liked you. I made a call to you. Don't piss me off,
Spending,
Bernie,
as you
please.
indicated, 2 or 3 times as much per capita in healthcare as other nations. We have 85 million people who are uninsured, underinsured. We have all kinds of chronic illnesses. Our life expectancy is lower than other countries. And for working class people in this country, they are living 6-7 years.
Don't piss
shorter
me off,
lives
Bernie.
than
Please
top
don't piss me
1%.
off, Bernie.
We got a problem, okay? And I'm going to suggest some ideas that I think...
We do have a problem. You've been saying Medicare for all, but we're not going to get there yet.
This country made over $70 billion, while at the same time 85 million Americans are uninsured or underinsured.
I agree.
Do you agree with me that the United States should join every other major country on earth and guarantee health care to all people as a human right? Yes? No?
Senator, I can't give you a yes or no answer to that question.
Health care a human right? Is health care a human right?
Yes.
In the way that free speech is a human right,
Yeah.
I would say it's different because with free speech doesn't cost anybody anything, but in healthcare, if you smoke cigarettes for 20 years and you get cancer, you are now taking from the pool.
Well,
and so are you guaranteed the same right,
and if
or is there
okay,
also
look,
a duty?
I'm sorry. I'd love to talk for an hour with you. We got a few minutes left here. All right. Every other country on earth says healthcare, whether you're poor or rich, young or old, is a human right. I'm not hearing you say that. All right. You've talked about the drug companies, and maybe we agree on this one. As you all know, despite the drug companies making over $100 billion in profits, paying CEOs outrageous compensation packages, we in some cases pay 10 times more for the same drug. Will you support legislation that I will introduce which says that in America we should not be paying a nickel more for prescription drugs than people around the rest of the world? Yes, no?
To equalize it?
Not to equalize it, that we should not be paying more than other countries for the same damn drug.
President Trump has asked me, in fact, I had a meeting with President Trump a week ago where we showed him the charts.
He knows the charts.
We're paying 10 times more from Europe.
That's right. And are you going to commit to us that you will end that absurdity?
I think in principle we can. We should end that disparity.
Good. Okay. That's great. All right. I happen to believe that climate change is real, it's an existential threat, and it is a healthcare issue. Donald Trump thinks that it is a hoax originating in China. Question is, in your judgment, is climate change a hoax or is it
What
real?
kind of question is that? That
devastating
question's not even relevant right now, Bernie.
Trump and I, from the beginning, from our
Bernie, you was
first
cooking,
meeting,
then you asked that
agreed on
irrelevant
issue.
question.
I believe climate change is existential. My job is to make Americans healthy again.
All right,
And
you believe that,
that is
you
what
think
I'm-
that you disagree with Trump, you don't think climate change is a hoax, is what I'm hearing.
my job here is to
I'm
make
just asking you that,
Americans
Mr. Kennedy,
That-
not your question.
I
It
answered
doesn't
your
matter.
question, Senator Sanders.
Okay, you disagree with the president on
I answered your question.
that. Okay.
Bernie, no gotchas, bro.
Point that Senator Hassan made. Look, there is no question.
No gotchas,
that abortion
Bernie.
is a divisive issue in this country. I would say a majority of the people are pro-choice. There's a strong minority who are pro-life. A year and a half ago, you went to New Hampshire, running for president, gave a speech, and you talked about government should not tell a woman what she can do with her own body. That's her choice. Now, I think everybody on that side is pro-life. I think everybody here is pro-choice. I have never seen any major politician flip on that issue quite as quickly as you did when Trump asked you to become HHS secretary. Tell me why you think people should have confidence.
I'm disappointed in you, Bernie,
consistency, and in your
because you're not focusing on the real issues that he's trying to correct. And that's why I'm not fucking with it right now, Bernie.
in such a short time.
Senator, I believe, and I've always believed, that every abortion is a tragedy.
But
I
you
don't-
told the people of New Hampshire that it was their right. All right, let me do a last question because I'm running out of time. I think the gist of what you're trying to say today is you're really pro-vaccine, you want to ask questions. You have started a group called the Children's Health Defense. You're the originator. Right now, as I understand it, on their website, they are selling what's called onesies. These are little things, clothing for babies. One of them is titled Unfaxed, Unafraid. Next one, and they're sold for $26 a piece, by the way. Next one is
So what?
No vax, no problem. Now you're coming before this committee and you say you're pro-vaccine. Just want to ask some questions. And yet your organization is making money selling a child's product to parents
And-
for $26
And this is the exact reason why Bernie Sanders lost his relevancy.
vaccines. Can you tell us
It's the
now
truth. This is the exact reason.
that you are pro-vaccine, that you're going to have your organization take these products off the market?
Senator, I have no power over that organization. I'm not part of it. I resigned from the board.
That was just a few
Leadership.
months ago. You founded that. You certainly have power. You can make that
I've-
call.
I've-
Are you supportive of this?
I've had nothing to do with
Are you
leadership.
supportive of these onesies?
I'm supportive of vaccines.
Are you supportive of this clothing?
This
which
is stupid.
literally
That's a
anti-vaccine?
stupid question.
I am supportive of vaccines. I will.
That's a stupid
I like
question.
good science, and I want to protect.
But you will not tell the organization you founded not to continue selling that.
Who cares?
Mr. Chairman.
Senator Blackman.
Thank you so much.
So I'll say this. I'll say this. Bernie Sanders, we can believe it or not, a lot of people have a brain, and a lot of people can see when they're being lied to and when they're being manipulated. We can see it. We know when we're being lied to. We know when we're being manipulated. I know when someone is trying to obfuscate. I know when someone is trying to slander a nigga. I know you asking about onesies, bro. That's not his job. You're asking about abortion. That's not why Trump has him there. One thing at a time, bro. Yeah, you might support Medicare for all. No, I agree. Our healthcare shit is bad. But that's not his job right now. And for you to... That's the reason you lost your relevancy, Bernie Sanders. The exact same moment when you decided to stay quiet when RFK was running, that's when you lost your relevancy. That's when AOC lost her relevancy. That's when Pocahontas lost her relevancy. Because we see through your shit. And the people still gonna speak up. So, okay, keep fucking with it. Alright, bet.
Confirmed you and your CMS administrator will work with us to make certain that the area wage index is balanced and that it is.
And they want to have their cake and eat it too. They want to have their cake and eat it too, right? They want to still make sure that he can't sue Big Pharma
For our entire country. And I talked a little bit about my commitment to rural health earlier in this hearing. The regional price points, as you know, are set by Congress and not by HHS. I will certainly, and I know Dr. Oz will certainly work with you to make them sensible.
We look forward to that. Also, you and I, before you came forward as the secretary, the nominee, we had talked in years past about over-medicating youth and concerns over that. And I was looking at a report from TennCare, which is our Medicaid program in Tennessee. And I was concerned when I saw a number that TennCare had spent $90 million in 2024 alone on ADHD. This was 417,000 of our children. And $90 million. To me, that is heartbreaking, what is happening there. So how will you prioritize oversight of prescribing practices while promoting alternative solutions such as counseling, behavioral therapies, community-based interventions for our youth?
Exactly, and that's the solution. 15% of American youth are now on Adderall or some other ADHD medication. Even higher percentages are on SSRIs and benzos. We are not just over-medicating our children, we're over-medicating our entire population. Half the pharmaceutical drugs on Earth are now sold here. 70% of the profits from pharmaceutical companies are from the United States, even though we only have 4.2% of the world's population. Not only that, but a recent study by Cochrane Collaboration founder Peter Ghosh found that pharmaceutical drugs are the third largest cause of death in our country after heart attacks and cancers. Oh, they're not making us healthier. We need community health initiatives. We need access to treatment. We need exercise. We need better food.
Okay, let me talk to you about one of those access points.
Well, keep it quick, bitch.
And this highlights a problem we
Talk
have
to me
in
quick, not
federal
what'd you say,
Medicaid
cheese?
law.
Talk to me quick, slick, not quick,
Since
whatever you say,
Medicaid's
however you say it.
enactment, states have been prohibited
Y'all taking
from
too much of my
using
nigga time.
Medicaid funds for care provided by institutions for mental disease. We refer to them as IMDs. These are psychiatric hospitals, residential treatment facilities with more than 16 beds. This is a discriminatory exclusion, and it denies payment for medically necessary
What are you talking
care
about,
based
bro?
on the illness that is being treated, and
What are you
it
talking
has
about?
perpetuated unequal coverage in mental health care. So if you're confirmed, when you're confirmed, will you commit to working with me on repealing this discriminatory exclusion and ensuring equal access to mental health care for Medicaid beneficiaries?
Yes, Senator.
Thank you so much. I've got a question on PBM reform, one on artificial intelligence in healthcare. In the interest of time, I will yield back. I look forward to seeing you help make us healthy again.
Thank you, Senator.
And we all see through your
Senator
bullshit.
Lujan. Excuse me, just
We
made a
all
mistake.
see
It's
through your
Senator
bullshit.
Cantwell.
Thank you so much.
When you
Thank
lie-
Mr. Chairman, and just congratulations on your nomination, Mr. Kennedy. And I've been absent only because I've been in another hearing with the nominee to be the Commerce Secretary.
Is he nominated?
I will review everything that you've said today and look at that diligently. But one of the things that I wanted to discuss with
She
you
looks
is
like shit.
I represent a very big innovation state, and innovation in healthcare specifically. Innovation like NIH funding to the Fred Hutch Cancer Center that helped develop the HPV vaccine, which has the potential to eliminate over 95% of cervical cancer. NIH also funds a lot of
We don't need
jobs.
no more vaccines.
11,000 people in the state of Washington and over 1.2
We don't need no more vaccines.
$1.2 billion worth of grants. So while I agree with you on healthy foods, I definitely am troubled by the medical research side of innovation and some of the things that you have said. In fact, this issue about laying off 600 employees at NIH, or giving the fact that, to quote, give infectious disease a break for 8 years. So we've had a chance to talk about this a little bit, but the most striking example of this is when COVID hit. And we were the first in the nation. We had the first case, and it really was the fast response by the University of Washington that really helped save lives. So I just want to know that, are you aware of how harmful these issues could be for public health? That public health in and of itself could be affected by these kind of anti-science views?
Senator, I have always been a science person, a pro-science person. I believe in evidence-based medicine and gold standard science. And I said, and I've explained this before you came in, that 600 people out of a workforce of 91,000 is pretty typical. Last year alone, President Biden replaced 3,000 people at HHS and 700 at NIH. I want to say this. I said give infectious disease a break because that's been the principal preoccupation. Infectious disease, chronic disease is 92%, accounts for 92% of deaths in this country, and almost nothing is studied at NIH about the etiology of our chronic disease epidemic.
But right now,
the money is going to infectious disease.
But I get your point. It's an interesting point. The problem is we had to respond, and it's actually the Gates Foundation and a flu cohort that figured out what was wrong, and that we had an outbreak of COVID that was going beyond the very first case. And so we had to build a very fast response. So I take this too. The University of Washington has conducted groundbreaking stem cell research on fetal tissue. To me, I know there's probably a lot of people that may not agree with this, but we're making regenerative
idea
heart
what that
tissue
is.
now at the University of Washington.
Fetal
So,
tissue.
Yes or no, do you commit to protecting stem cell
Next time,
research
come in
for
the meeting on
scientific
time.
agencies?
How about that? How about you come in the meeting on time? How about that?
I will protect stem cell research.
Stem you, bitch.
Stem cell research
She ain't-
today can be done on umbilical cords. And
Yo, is she even qualified? Is she even qualified to ask him a question?
You'll protect the laws that are
I'll
on
protect you,
books
bitch.
today and the
No, I'm
research
kidding.
that's
All right,
done.
let me
My
stop.
job is, Senator, to enforce the laws.
Okay, so
We don't care what you got to say, shorty.
because PBMs are driving up drug prices, and one of the biggest things that we need to do here, I think, in a new administration, is get a handle on everything that is driving up prices and lower them. The report found that PBMs generated $1.4 billion from spread pricing. That is where they are able to basically set the price, not reimburse pharmacies, and then pocket the rest. We've had bipartisan legislation in several different committees now to get at this. What do you think the solution is?
I think one of the really notable achievements of this panel was the PBM legislation that they put together in a bipartisan way. I haven't met a single senator, well, actually one only, but of the 60-odd senators that I talked to, all of them talked about PBMs and how important it was. And President Trump, during his first administration, pushed through a law pushed a law to give transparency to PBMs. It got overruled during the Biden administration. Luckily, this panel is resuscitating that. President Trump is absolutely committed to fixing the PBMs.
My time is running out, so I just want to clarify. You believe that we should pass these laws that now have been proposed in the Senate?
I haven't read the entire law, so I don't know, but I think that
And bitch,
we
you
need
showed
to
up late.
reform the PBMs. I think we need
But, and
to
somebody
get rid of
suggested,
all of these vested interests that are draining money from the system.
okay, somebody suggested though that you thought you should convene the PBMs and talk to them about some sort of self-regulation. So I am trying to distinguish between these people who basically are doing illegal activities and ripping off, really, they're creating pharmacy deserts in my state. So I'm asking you whether you believe that we have to legislate in this area.
Again, I'm not being evasive. I just don't know exactly what the law says. I met with the PBMs. I met with pharma. My job is to meet with all the stakeholders. I've been meeting with stakeholders for 40 years. People I was suing, you want to hear from the other side.
Well,
That doesn't mean I would let the PBMs write their own ticket.
I think
I support the efforts of this committee to come up with bipartisan legislation. President Trump wants to get the
Let's just make sure we know what PBMs
away
is.
from the PBMs and send it back to.
I don't know if they're going to say
primary
it, so let's
care
just make sure we know what
patients in this
PBMs
country to
are.
high-quality healthcare.
I'll ask you for the record, since my time's expired, to look at the legislation that came out of the Commerce Committee that defines the legal activities that they are doing to drive up prices, and get us an answer for the record. Thank you, Mr. Chairman.
In principle, I support that legislation.
Thank you. And
Okay,
let
okay.
me just tell you the list as we have to move forward to the ending here.
Companies that administer prescription drug benefits for health insurance plan. Okay.
Senator Young and Senator Welch.
And let me say again, Mr. Chairman, this is a matter of such importance. A number of my colleagues would like a second round, and I think it would be important to offer, say, a modest amount of additional time to get into this on both sides. I know I have some questions. I want my colleagues to have the opportunity to raise their concerns as well.
Well, I've said, as I have indicated to you, Senator White, and I'm not going to do a second round. I have been very generous with the senators. I think almost every single senator has had 7 minutes at least. And I will give you a second, as is our practice between the two of us.
I'll then divide my time up with my colleagues.
Okay, you are welcome to do that.
Thank you.
Senator Lujan.
Thank you, Mr. Chairman. Mr. Kennedy, when we met, you stated to me that it is not your goal to take away programs that work for Americans. Do you stand by that statement?
Yes, Senator.
Mr. Kennedy, do you know how many Americans rely on Medicaid?
It's about 72 million plus.
It's not relevant. That's not relevant. We're talking about getting the forever. You're talking about baseball and we're talking about football. We're talking about getting the toxins, getting the chemicals, getting the red dye, getting the tartrazine, getting the forever chemicals out of our food is what we're talking about. We're not talking about Medicare right now, right? Our healthcare is in shambles. That's a conversation for another day. We're talking about just cleaning up the health. If we address the root problem, oh my God. We get that you get donations from whoever. I don't even know, right? But we're talking about football. You talking about baseball? Jesus Christ!
I believe that Medicaid is a critical program, but that it's not working as well as it ought to be. And President Trump has asked me to make to make it work better. That most Americans are not happy with it. That the premiums are too high.
We all know
the
this.
deductibles are too high, and everybody's getting sicker. Too much money is going to
Mr.
the
Kennedy?
insurance industry.
I have a series of yes or no questions. They're pretty simple. Because you heard we're not going to get a second round of questions, I ask for your indulgence to be able to get to them yes or no. In New Mexico, as you know, Medicaid is often measured state by state. It might surprise you if you look at some of those surveys. In New Mexico, the response was 90% of New Mexicans on Medicaid report satisfaction getting care, 80% getting specialist care, 85% getting urgent care, 95% ease of filings out of focus. Not to pick on any one of my colleagues, but in Louisiana, 86% of people on Medicaid are satisfied with their interactions. 83% are satisfied getting care. 85% are satisfied getting specialized care. 82% getting urgent care. I can go on state by state, but we don't have the time today. Yes or no, do you support cutting Medicaid or reducing, and especially in an area where you and I spoke about with the federal investment in Medicaid, which is known as FMAP?
President Trump has not told me to that he wants to cut Medicaid. He's told me to make it better.
Do you support cutting, yes or no? Let me ask you this way, since it's only about President Trump.
I support making it better, Senator.
If President Trump asked you to cut Medicaid, will you do it?
Oh, it's not up to me to cut Medicaid. It would be up to Congress. And
you don't
I'm going to work. I'm going to work.
Mr. Kennedy, you don't want to answer? I'll move on. Do you know how many states will end? Mr.
Got
Chairman,
you. I got you.
So I understand that people are getting asked to leave if they stand up with signs, but there's a lot of other as well, Mr. Chairman. So it needs to be extended to everyone. As Mr. Kennedy said, we should respect each other when we have a difference of opinion. We're just trying to do our jobs here and trying to ask questions. That's all. And that's all I'm doing with Mr. Kennedy, folks. So I just hope that we can
Senator Lujan, you are right, and I ask the audience to please be respectful.
Thank you, Mr. Chairman. I appreciate that very much.
All right, listen.
Do you know how many states?
We know your game. So no, the audience. They're talking about the live audience right now. Yeah, the live audience. There's an audience in there. It's packed. It's packed. It's the Make America Healthy Again movement. It's a movement. Independent supporters. It's a movement. We know your game. We got independent media now. That'd be different if this was 4 years ago. You could lie to us on CNN. Blah blah. We know your game, and we're watching. You got 16,000 people watching you right now, commenting. Doing their own research. On X, you got people commenting. Oh, wait, didn't that bitch get a $200,000 donation from? Okay. Oh, wait, didn't Elizabeth Warren get? Okay. Right? So, no, we don't have to be respectful, but we will be respectful. We don't have to. And I still might not be respectful. I don't know. Right? But I'm not. We're done with your game. And I'll tell you that. So, whatever, fat man, hurry up and say your question.
American communities.
Fat boy.
One of the concerns that I have are these programs matter to folks. You share your passion about caring for folks. I believe that passion. My question in this area is, as you know, when folks are doing research and they're going to check to see if medicine works on someone, if they're not included in that trial, it often doesn't help them. That's what all the evidence shows. So what are you going to do when programs are eliminated to require the inclusion of Native Americans in clinical trials when it comes to life-saving medicine?
What?
I'm going to do everything I can to make sure that there's Native Americans in clinical trials. As I said to you when I visited your office, I spent 20% of my career working.
What are you talking about, bro?
My family.
We're trying to win a football game.
My family, father and uncle were big critics of the Indian Health Service. Failure to deliver good health results or health care on the reservations. I'm going to bring a native in for the first time.
We're trying to win a football game.
Office. That all the major decisions in my office will be that he will have it. We've already interviewed candidate, a very, very good candidate, will have direct impact on all the major offices. One of my priorities is to improve.
I appreciate that. I have a follow-up in that space specifically. Will you commit to finalizing the congressionally mandated FDA guidance to increase clinical trial diversity?
Just repeat that again. I'm sorry.
Will you commit to finalizing the congressionally mandated FDA guidance to increasing clinical trial diversity?
Yes.
I appreciate that. Will you commit to reinstating all of the pages that were eliminated and people that were fired from this administration that have this responsibility?
I cannot commit to that because I don't know who they are.
Well, there's
I'll
some
commit
folks out
to
there doing the
working
work.
with you to make
Mr.
sure
Kennedy,
those positions are adequately staffed.
I will follow up in writing in those specific areas because I think there's some commonality here, but answers matter. And so I'd like to get those as timely as possible.
Shut up,
last
fat
thing,
boy.
Mr. Chairman, that I'll say is one of the conversations I had
Who is this fat boy?
before this hearing was with a family that I've been working with.
Cause I get the.
I work with my Republican colleagues when it comes to autism and federal programs and making a difference in these families' lives and this little girl's life. What I'm asking now, Mr. Chairman, is unanimous consent to enter into the record an article from Autism Speaks titled, quote, "Do Vaccines Cause Autism?" End quote. And I'll note that the first sentence states, quote, "Vaccines do not cause autism," end quote. Thank you. I yield back.
Without objection. And before we move on, we've had a request from several quarters for a quick restroom break. We will take a 5-minute recess. I'm sorry to those remaining 5 or 6 senators who must wait a few minutes, but we will have a quick break. We will be back as soon as we can.
Oh shit. Ugh, man. Okay, well, we'll let them have their recess. I actually needed a recess myself. Let's hop on the game. Let's hop on the game until they come back. Again, it'll be a 10-minute recess. So let's just hop on the game, get a match in. No, you don't. Oh, no, you don't. 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 You don't do that. You don't do that. You don't do that. You don't do that. Yeah, man. I see right through your game. You know, and I can go down the line for each senator, right? We see your game, man, and it's not gonna be played on us like that no more. And we're looking, and the eyes are on you. So I'm talking to you, Elizabeth Warren, and whoever else is taking money from Big Pharma, et cetera, and so forth. We see you, we hear you, and we got our eyes on you. And you. The ball's not in your court no more, right? Let's put it like that. The ball's not in your court no more, and it won't be for a long time. It won't be for a long, long time. How about that? Man, I'm excited. Make America Healthy Again season, baby. You gotta love it. You gotta love it, gotta love it, gotta love it, gotta love it. Gotta love it, gotta love it, gotta love it, gotta love it. Gotta love it, gotta love it, gotta love it, gotta love it. Alright. So while they're having their little bathroom break. Oh, look. All right. Shit is going on. Oh, that's what's going on. Yeah, man, we see your game. We see your game. So give me a couple minutes. When that comes on, I will surely have it right back on. We will continue the hearing. We will continue the hearing. That's my laptop camera why I look so poopy. We will continue that hearing, man. And that's just gonna be that. In the game, what the fuck? This shit is going on. Boom, 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 boom. Alright, are they back yet? They'll probably be back before we can even go play a match. Okay, are they back? I don't think they're back yet, though. Hold on, let me find that link. Are they back? Are they back? Hold on. Why is it loading so slow? Are they back or no? I don't think they're back yet. It's still loading. I'm seeing a loading screen. We'll watch. I guess we're just watching on YouTube until the hill gets this shit together. Why is my game not coming on? What the fuck is going on with my Elgato, bro? Oh, that's why. This one. Ah, let me see. By the time we hook this up, it's gonna be back. The hearing gonna be started again. Oh, maybe we get a match here now. How long did it take some fucking senators to piss? Shouldn't take them that long, right? Okay, let's see if it's back live yet.
Let's compare a HELOC to an alternative that comes with no monthly payments. A HELOC is a line of credit from your home's equity and typically requires an extensive application process, has strict debt to income requirements, and comes with
And at age, we don't
it started back up.
on all these things. And that is
all right. About a minute into it. We're about a minute into it. All right, we're a minute into
to
it.
study the things that are truly making us sick and are not only contributing to chronic disease, to mortalities from infectious disease. We need to get a handle on this, because if we don't, it's an existential threat. Our country is not going to be destroyed because we get the marginal tax rate wrong, or because we get one of these culture war issues that we've been
That's
talking
stupid.
about wrong.
Yes.
It's going to be destroyed if we continue down this trajectory of chronic disease. We need to fix our food supply.
That's what they want us
And
to
that's
argue
number
over.
one.
Dumb shit.
Thank you, Mr. Kennedy. Certainly, I share your concern with ultra-processed foods. On the other end of this food chain are my farmers and ranchers back home. Would you just take a second and share your compassion, how you feel about farmers and ranchers, that they respond to the market? They don't dictate the market. They grow what the market is wanting them to grow.
And Senator Hawley told me the other day that his brother-in-laws are all farmers. And he said 4 out of every 5 of his brother-in-laws has Parkinson's disease. And that kind of cluster we're seeing across farm country of cancers, autoimmune diseases, obesity, etc. Oh, it's and we can now not export American food to Europe because the Europeans won't take our food. That's not good for farmers. We're also destroying our soil because some of the chemicals that farmers use destroy the microbiome, and that causes the erosion of the soil. You can't get water infiltration. Water pools up and it washes the soil off. Agronomists now estimate that we only have, if we continue doing these processes, only 60 harvests left before our soil is gone. So farmers are using seeds and chemicals that are, over the long term, are costing them and us. And what we need to do is we need to support the farmers. We need the farmers as partners if we're going to make them work. And
It's going to take all of
a
us.
single farmer to go out of business.
It's going to take all of
under
us.
our watch. I don't regulate farms. If I'm privileged to be confirmed, I'm not regulating farms. That's under USDA. But I want to partner with all of my decisions with USDA and with the farm community to make sure that we don't lose more farmers in this country, but that we also transition. We offer and incentivize transitions to regenerative agriculture, to no-till agriculture, and to less chemically intensive. And by the way, I've also met with the chemical industry and the fertilizer and herbicide companies, and they want to do the same thing. Oh, and I think we're on the trajectory to do that, and we need to incentivize initiatives to accelerate that trajectory.
Mr. Chairman, if I could, the great news is that my farmers in Kansas are selling products to Europe. That today's regenerative practices, soil health, all those things are priorities for Kansas farmers. Many of us are doing many of those things already. We just need it to be more widespread. If I could just wrap up my remarks, though, is that, again, going back to the big picture here, 60% of Americans have a chronic disease. Mr. Kennedy, I believe for such a time as this that you're not just one of 300 million people. I think that you are the person to lead HHS to make America healthy again, that God has a divine purpose for you, and I look forward to your confirmation and working with you to make America healthy again.
Thank you, Senator.
Thank you.
That's the people.
Senator
That's
Warnock.
the people. Look at this girl.
Thank you so much, Chairman Crapo
This girl in the
and
back.
Ranking
This girl's
Member
cute.
Wyden. It's great to be here. Mr. Kennedy, welcome. Welcome to you and to your family. Thank you for meeting with me a few days ago. I'd like to
Keep it
follow
quick,
up
keep it
with
quick,
my
keep it
mic
quick. Come on,
with,
come on.
Some of the issues that
Talk to
we
me quick, not slick.
discussed in
However
my
you say it.
office. I want to talk to you first about the CDC, or the Centers for Disease Control and Prevention. I'm proud of the work that the CDC does, proud that it's located in Georgia with more than 10,000 employees in my state. If confirmed, you would be the cabinet secretary over the CDC. Representing HHS, it's about 29% of the federal budget. CDC is a part of that. Do you agree that the CDC's work is critical to Georgia, critical for our country and the health of the entire world.
Yes, Senator.
Senator Isaacson, my Republican predecessor, would have agreed with that. Bless his memory. He was a fierce advocate for the CDC, as am I. The CDC is an agency filled with hard-working, dedicated public health servants. They wake up every single day.
I don't give a fuck, bro.
Keep us safe.
Bro.
We don't think often enough about.
It's not time. This is not the time to glaze the
It's easy not to
CDC.
celebrate folks who are protecting you.
This is not the
That
time to
which doesn't
glaze
appear
the
because of the work
CDC.
that they're doing.
This is
So
not the
grateful for
time.
work that the CDC employees do. Some of them are members of my church. I saw that deep commitment firsthand when I visited the CDC just last summer. Mr. Kennedy, you have compared the CDC's work
I was curious.
to
Hold up.
Nazi death camps. You've compared it to sexual abusers in the Catholic Church.
We're trying to play football.
You've also said that many of them belong, this is a direct quote, many of them
Again,
belong in jail.
again,
For me,
irrelevant.
those are disturbing characterizations of the CDC workers that I know who are trying to keep the American public safe every single day. And as you are presented as the nominee for this position, I need to know, do you stand by those statements that you made in the past?
Like, what are you
or
talking
do you
about,
retract
bro?
those previous statements?
What are you talking about?
Senator, I don't believe that I ever compared the CDC to Nazi death camps. I support the CDC. My job is not to dismantle or harm the CDC. My job is to empower the scientists if I'm privileged to be confirmed.
So you retract those statements?
I'm not retracting it. I never said it.
Well, actually, I have a transcript
Of me saying that it's a Nazi death camp.
Let me read your words. It says that the institution CDC and the vaccine program, is your description of their work, is more important than the children that it's supposed to protect. And you know, it's the same reason we had a pedophile scandal in the Catholic Church. It's because people were able to convince themselves that the institution of the church was more important than these little boys and girls who were being raped. That's pretty provocative language. You said in another statement to me, this is like Nazi death.
You see how, like,
I mean, let me finish. I'm just reading your words. I mean, what
Like-
happens? What happened to these kids? 1 in 31
who gives a?
boys
What are you
in this
talking
country,
about, bro?
Their minds are being robbed from.
And people like me can see right through it, and we do see right through it. So, okay.
The injury rate to our children to other atrocities. And I wouldn't compare of course, the CDC to Nazi death camps to any.
Like, that's irrelevant. That's a waste of time. That's a waste of a question.
Has been interpreted that way. Yeah, I don't agree with that. In 2003, the United States Congress Government Oversight Committee ended an over a year investigation of the CDC and used almost that same language. They said that the CDC, just one division, one branch of the Immunization Safety Office, had put institutional self-interest and pharmaceutical profits ahead of the welfare and the health of American children. So that was a conclusion by Congress. And I repeated that.
I'm asking you because you're the nominee for HHS. It sounds like you stand by those statements.
Senator, my objective is to support the CDC. There's nothing I'm going to do that is going to harm CDC. I want to make sure that our science is gold standard science, so that it's free from that same government oversight investigation committee. That the panels, the ACIP panel, within the CDC, I think 97% of the people on it had conflicts. I don't believe that that's right. I think we need to end those conflicts.
That's what you need to be asking about. That's what he needs to be asking about. Ask about the conflict of interest. Fat black man, whoever you are, that the camera's not showing. Ask about the conflicts of interest. Not about some Nazi camp. What the fuck are you talking about? This niggas is sick. We're obese. We're fat. We're autistic. We're giving little babies mercury shots. Like, come on, bro. And you ask about a Nazi camp? Don't piss me off, man. Get the fat black man. I don't want to get next. Next.
So you agree with the action
Next.
that gagged HHS and CDC from communicating
What are we doing, man? What are we doing?
Public health information.
That directive made sure that no public health and only non-essential travel and mass communications were temporarily suspended pending the confirmation of a new HHS secretary. This is standard operating procedure for every administration.
I get it. I don't think what we've seen over the last several days is standard operation for new administration. I think we're seeing some unprecedented actions, but you agree with it. Last night, members of the CDC, along with other federal employees, were actually invited to resign. These buyouts, and I got text messages and folks I know work from the CDC that do this important work who got that note, and it's really important because my experience is that when you send out that kind of note, the folks who resign are the folks who you least likely want to see resign. They got other options. They're gifted folks. They got a lot of expertise. They have options. A lot of them are doing this work because of their patriotism, because of their commitment.
And this nigga is still glazing the CDC.
The buyouts that were presented to
this
CDC
nigga is still glazing the CDC.
I agree. At the vast majority of this.
Okay, sure. I'm sure the CDC had. I don't know, man. Next guy.
Can you just answer yes? Okay, you agree with the buyouts. In our meeting, I asked you to confirm your support for the Affordable Care Act. You also mentioned that you and President Trump want to fix the ACA by making premiums more affordable. Can you answer me yes or no, as I don't have a lot of time? Did you know that tax credits that help families afford health insurance and save Georgians an average of $531 per month per person are set to expire at the end of the year? Did you know that?
I do.
We need to move on.
Do you support Congress extending these tax credits so that Americans can continue to afford health care?
Congress has to make its own decisions about that.
Stop acting like they had our best interests, like they're trying to protect.
I'm having a lot of trouble getting the witness to
I think that's what pisses me off the most. I'm sorry. What pisses me off the most is that they act like they have our best interests, and they don't. And it's clear that they don't. And it's clear that they haven't, and they have not for a long time. And I could go on.
To move on.
Yeah, move on. Move on.
That the fact that you find it difficult to answer basic questions is deeply troubling for me.
Yeah,
You present yourself as a nominee to run HHS. Thank you so very much.
Senator Smith.
I've been in courts all over the country and prosecutors.
Mr. Chairman, you told me I'm out of time, and the witness continues to filibuster even after I said I'm done.
Senator Smith.
Mr. Chair, thank you.
And that's why that guy will lose his relevancy.
Welcome, Mr. Kennedy. So, Mr. Kennedy, I don't have a question for you on abortion. I think that my colleagues on both sides of the aisle have covered this, but I want to say I can respect people who have different views than mine on this issue, but it's hard for me to respect people who won't give a straight answer to what they think on this issue in particular. Mr. Chair, I just want to note that I understand that anti-choice advocates have said that in these hearings they were looking to hear Mr. Kennedy provide some reassurance that he is on their side, and I'm not hearing that. And I think most Americans
He's not.
are for some hint that the decisions that people make about abortion should be personal and private, and they should be free
He's
to
not
make
on your
those decisions
side.
without government interference. And
That's
I'm not
why
happy with
that
either. To make it worse, the answers that you have given tell me that the Trump administration is more than willing to restrict or even ban medication abortion without a single act of Congress, and even in states where abortion is legal. And what is clear to me is that you and President Trump are dangerous to women's access to mifepristone. So having said that, I want to move to a different topic. Mr. Kennedy, I appreciate Senator Cornyn's questions about mental and behavioral health, something that I care a lot about. I know that you and your family have had personal experience with mental health challenges, as have I. And I agree that the mental health crisis in this country is a crisis. So let me ask you, in an interview in 2023 and again in 2024, you blamed school shootings on antidepressants. You said, and this is a quote, "There is no time in American history or human history."
Now, she could spend that time asking, like, hey, why are we the sickest in the country, right? She could spend time asking real questions that would make Americans better, right? She's not.
Anybody can answer that question, and I didn't answer that question. I said it
So
should
your
be
answer
studied.
is,
I said
Their questions are trying to make him look bad. Their questions, or even if you want to call, I don't know if you want to call them questions, they're trying to make him look bad. And that just, when they try to make him look bad, that makes me know, that confirms, like, okay, this is the guy. Because it's the same game, man. It's the same game, bro. Do they think we're dumb?
and of those that were, there was no evidence of association.
Like, I can't see when I'm being lied
I
to.
don't think you
My
can
question
say that,
is-
Senator.
What's your question?
Rules,
What is your
That
question?
is, Mr. Kennedy, do you think that people who take antidepressants are dangerous?
What?
I
That's a legit senator question. That's a legit senator question. Do you think people that take antidepressants are angry or crazy? You get 4 minutes and you ask them, do you think people that take antidepressants are angry? Like, what are you talking about? What do they be talking about, bro?
My name is Tom Holman. I'm the former Arts Director on President Donald Trump. And I'm here to ask America to wake up. You can protect yourself.
Is that what you believe?
of course I didn't say that
Yes, you-
anybody should be compelled to do anything.
No,
I'm
but you
for-
said they should be sent. There,
I
you
said they should
described
be
folks-
available to them.
You
I
said
didn't
that-
say they should be sent.
You said that folks
Kicking and
that take
screaming.
antidepressants are like addicts. That I can provide that,
Oh, I
Mr.
think
Chair.
they should have.
Nothing about the chronic disease, nothing about the autism, nothing about the obesity, nothing about how we're the sickest in the country, nothing about how everybody else is living 10 years longer on average around every other major country, UK, China, etc. Nothing about that. Oh yeah, you said people with antidepressants 5 years ago is angry. Do you see what they're doing? This is not, it's like right in front of me. Oh yeah, that statement from 4 years ago when you said, like, what are we doing? What the hell is going on here? That's what pisses me off.
Generation of SSRI uptake inhibitors, which help to clear my mind, get me back on track to being a mom and a wife and a productive, happy person. And I'm really grateful for that therapy. So I have some experience with this, and I think that everyone should have access to that care. And your job as secretary is to expand access to
find my
care,
piece.
not to spread lies and misinformation. And the things that you say, Mr. Kennedy, they live on. They have impact. And we're having this conversation at the same moment that
Who is it? They're lucky they're not showing her
Try to
face.
figure out how to save money.
They're
And
lucky they're not
yes,
showing her
they wanna
face.
cut Medicaid. Let's just think about this for
They're
a minute.
lucky they're not
You're gonna
showing. Maybe I'll go back to the
should
hill
you
so I
be
can see their
confirmed,
faces.
You would be responsible.
Maybe I'll go back to the
CMS,
hill so I can
which
see their
provides
faces. 'Cause I need to
mental
see.
and behavioral health care to
I need to put a face on
millions
these
of
bitches.
Americans. Close to 40% of folks on Medicaid
I wanna put a face to these
have a
people.
behavioral health condition. And you would be part of this administration that would be looking to cut Medicaid. So, Mr. Kennedy, these statements that you
Look, it's
made
all about
linking
Kennedy today.
antidepressants to school shootings, they reinforce the stigma that people who experience mental health every day face every single day. And I'm very concerned that this is another example of your record of sharing
But I wanna put a
false and
face to
misleading
it.
information that actually really hurts people.
Senator, you're
Thank you, Mr.
mischaracterizing my statements.
I am only putting into the record what you have
No, you're
said.
mischaracterizing his statements.
Mischaracterizing my statements, and I'm happy that you had a good experience on SSRIs. Many Americans have very good experience on it. Others have
That
not.
would be an issue between them and their physicians, and not for
And
the future
exactly.
head of HHS to be just putting out misinformation
Exactly.
about the dangers of SSRIs and other antidepressant medication spreading the
Who is
stigma
this?
and the
I gotta put a
fear
face
that
to
we're
it.
actually
Hold
trying
on,
to overcome.
hold on.
Do you think physicians, when they make that prescription, ought to have access to good science?
Of course they do, and
Right,
I
that's
don't
all I
think that.
believe too. And you and I are in agreement, Senator.
And to your point that you made when you made these statements, it was not based on good science. I don't know what it was
I
based
was saying
on.
the science needed to be done. I was
Dumb-
saying these are potential culprits.
Dumbass
And I'm
bitch.
coterminous, and I named other things. I said video games.
Is this it?
I said social media.
Hold on. This it?
Questions and giving, especially when it comes.
Okay, they ended their live stream.
Have about what Mr. Kennedy has said of linking antidepressants to school shootings. Thank you.
Like, what?
Senator
What?
Young.
Thank you, Mr. Chairman. Good to see you, Mr. Kennedy. To follow up on that spirited exchange, in talking with you and reading about your vision for the department, you said one of your goals is to return public health agencies to the gold standard of scientific review. You've alluded to the gold standard a number of times today. So I'm going to give you an opportunity, uninterrupted, but hopefully not too extensive, to tell me and others what you mean by this gold standard.
The gold standard means real scientific research with replication of studies, which very rarely happens now at NIH. We should be giving at least 20% of the NIH budgets to replication. We should make sure that all the science is published with the raw data. We should make sure that the peer reviews are also published. And I'll give you a quick example.
This is simple
20
stuff.
years ago, HHS, NIH scientists did a study on Alzheimer's, which they said it was caused by amyloid plaque. After that, NIH shut down studies of any other hypothesis. 20 years later, we now know that those studies were fraudulent. NIH has funded 800 studies on a fraudulent hypothesis, and we've lost 20 years in figuring out a cure for Alzheimer's. And that's just one example. I could give you hundreds. We need to end that. We need to end the old boy system. We need to have replicatable science and be completely transparent about raw data.
Thank you, sir. In recent years, particularly during the COVID pandemic, there's been a lot of skepticism about our public health institutions. Some of this, I would say, is warranted, but it's now created a pervasive lack of trust from the public that these institutions are acting in bad faith or failing to act in objective criteria, failing, in short, to act in the best interests of the public. If confirmed, Mr. Kennedy, how will you work to regain the public's trust? I suspect it'll take some time in these important public health institutions.
I'm through radical transparency. I'm going to make the reason people don't trust the public health agencies is because they haven't been trustworthy. And you gave the example of COVID. At the beginning of COVID, everybody was rushing to get that vaccine. We had over 90% vaccination uptake.
Yes, sir.
CDC's most recent recommendation is that Americans take the 8th booster. Only 23% of Americans are complying. That means 77% of Americans no longer trust CDC, and that is the problem.
Yes, sir. In the absence of full information, might it, I think I agree with you, but I want your response. Might it make sense to share that absence of full information with the American people, that uncertainty? I think one of the things by observation and experience that I saw during the pandemic was we had certain prominent doctors appear on television and indicate, no, you absolutely must not wear a mask. 2 weeks later, it's yes, you must wear a mask. But they were certain. And they even demonized people for not following the latest science, knowing there's a high level of uncertainty in that science.
They demonized you. They called you stupid. They said you didn't know.
Radical transparency demonstrates humility. Help rebuild trust over a period of years?
Absolutely. We need to tell Americans what we don't know. We need to make sure studies that reach a null hypothesis are also published. And that doesn't happen.
Sir, I think you are right about why healthcare costs are so high in the first place. The answer is indeed chronic disease. 90% of our healthcare spending goes towards managing it, as you say in your open statement. It's not in the main because of waste, fraud, and abuse, although we know some exist. It's not in the main because we have greedy executives at innovative world-class companies. It's not in the main because we haven't yet adopted an unsustainable Medicare for all scheme. It's because of this. So I'm encouraged that you intend to make that a point of emphasis as it pertains to your future leadership. I will say, with respect to COVID, it's not over for a lot of Americans. It's not over. I know the mission accomplished banner was convenient for the last administration, but as we continue to navigate the ongoing impacts of the COVID pandemic, we have many individuals here in the United States and around the world who are suffering from long-term health effects that significantly impact their quality of life, work, and daily activities, and they've been largely ignored. Funding for long COVID research was appropriated by Congress in December of 2020, followed by additional funding directed by the Biden administration in February 2024. Patient
I think
groups
this
and
guy's on our side, so
publications have
we'll let him go.
criticized
We'll let him cook
the
for a minute. Give me 1 minute.
pace
I'll be
of
right back.
clinical trial design and enrollment. If confirmed, will you collaborate with healthcare providers, researchers, and effective communities to better understand and mitigate long COVID's impact? Yes or no, please?
Absolutely, Senator. There's 16 million Americans.
Will you commit to prioritizing long COVID research and integrate this work into broader healthcare policies? Yes or no, please?
Yes.
Patient groups, experts, and industry publications have raised concerns around existing long COVID funding being spent on observational research. In particular, criticism was directed towards recover funding being used to duplicate existing findings instead of funding trials for potential treatments or diagnostics. If confirmed, Mr. Kennedy, will you work with Congress so that going forward, long COVID funding will be directed primarily towards trial or novel research directions and not replicating existing observational research? Yes or no?
Absolutely, Senator, with enthusiasm.
Thank you so much. If confirmed, how will you create a balance between your personal priorities of chronic disease and healthy lifestyle and the ongoing critical work of the department in areas that are focused on incentivizing and advancing innovation in modern medicine and pharmaceutical discovery?
I think innovation is going to be the key to public health. And we have a unique opportunity now in history because of AI, because of telemedicine, and because of the quality of people that are now coming to HHS to actually save public health. But it's all going to rely on innovation, and I don't want to do anything that inhibits or impairs the pace of innovation.
That's encouraging. From approving AI algorithms to determining Medicare coverage, we certainly need more innovation, and we need good people in the department to assist with that effort. So I'll follow up with a question about how you're going to attract and retain good people. Thank you, Chairman.
Sorry to shut you down a little faster than I did the others, Senator. And we are up against a vote deadline here, and we have one more senator who gets his full time. I hope you'll keep it as close to 5 minutes as you can, Senator Welch. And then I've promised Senator Wyden, 5 more minutes?
To be divided 1 minute with my colleague.
And then if we can do that, we can get over to vote before they call the vote on the floor.
Thank you very much. Thank you, Mr. Kennedy. And as you know, I'm a big, have great reverence for your family from Massachusetts. When I got out of college, I was in the first class of Robert Kennedy Fellows, the memorial created by your family to honor the service of your father. I do community organizing in west side of Chicago. And I certainly admire your energy in your effort here and desire to serve. You know, there's a couple of things that are really important here. This is not just about a debate on vaccines. It's a debate about qualifications, experience, and priorities to the person that will head Health and Human Services. And it's not just about what your answers are today or what the questions are. It obviously has a lot to do with your whole record and your whole history. Your sister in her letter, pardon me, your cousin in her letter said, you've always been charismatic, able to attract others through the strength of your personality, willingness to take risk and break rules. That's, I guess, an attribute, but it can be a danger. The question I fundamentally have is whether your willingness to disrupt and maybe break rules is going to be dangerous and destructive. The character questions we didn't go into here, but there's some sketchy things you've acknowledged. Your history with heroin, you've gotten over that, but there's incidents that do, I think, concern the question of whether the stability is there to be in charge of this major organization. And that's compounded by my concern that you don't have any experience managing a large organization, that you don't have any experience in government. So those are things that have to be taken into account. But the issue for me is also priorities. A lot of your engagement in health has been on vaccines, big important issue. You actually disagreed, as I understand it, with President Trump about Operation Warp Speed. I think President Trump deserves a lot of credit for Operation Warp Speed. He knew we had to get a vaccine. And these other issues about a mask and whether you should wear it, whether when you got your groceries, the bag had to be left outside, remember that in the very beginning? Those are incidental to the core question that the president believed we had to have a vaccine. And you contested that. That worries me. That really deeply worries me. The other questions, Senator Cassidy asked you some questions about our healthcare system. I happen to believe that our healthcare system is profoundly broken. And it's not just about the chronic illnesses. That's about our diet, that's about our exercise. But we are getting premium increases in Vermont of 20% a year, 25% a year. And it's busting the bank for taxpayers, it's busting the bank for our wonderful Vermont employers who care about having health insurance that they can provide to their employees. Senator Cassidy asked you a couple of questions about how you would reform Medicaid, and I didn't hear an answer. You mentioned that you thought Medicare Advantage was good. You have a good plan. No focus on what an incredible ripoff was reported in the Wall Street Journal by United Healthcare, which was marketing Medicare Advantage and then paying doctors and nurses where they had assignments essentially to diagnose illnesses that didn't exist. So they made billions and billions of dollars. And I've seen nothing coming out of the Trump administration, and I've seen nothing coming out of your advocacy that is going after what is a rampant abuse by the insurance companies and overcharging people and not doing the job. And by the way, the United Healthcare people, when they did that, they overdiagnosed. When the person really got sick, they dumped them. They dumped them. Go to the nursing home on your own. That's a broken healthcare system.
It's a broken healthcare system. And we'll talk about the healthcare system. We'll talk about the healthcare system, but they dumped them. Y'all heard him, they dumped him.
All of our people are dependent on that healthcare system. And you're going to be working for a president who's on a lawless rampage right now, okay?
Lawless rampage.
Has done something reckless with the pardons to these cop beaters. I'm appalled by that. But that's just reckless. That's not illegal. He's impounded money. So right now, the Medicaid website went down. He's impounded money. So the community health centers that Senator Warner was talking about are up in the air.
We're trying to play football.
Do you believe that a president can impound money that has been appropriated by Congress?
Senator, let me answer the question about Medicare first. I have never defended that program or the rapacious behavior by insurance companies or the PBMs. I understand that's a huge problem. And
all right, I don't have time. We've got to get over to vote. So we can do this.
But you've asked me 5 questions. You got to give me a chance to answer one of them.
Please be brief.
Right?
Yeah, I
right?
I brought in, if I get confirmed, I've reappointed a general counsel. The first time in history, he's a former prosecutor who prosecuted the biggest Medicare fraud in the case in the state of West Virginia. I brought in a prosecutor for that job instead of a bureaucrat, precisely to address the important issues that you raised here. The only reason I didn't talk about these before is because I wasn't asked about them.
What about-
I agree with you 100%.
What about impounding, a president impounding money that, among other things, goes to healthcare?
And you're saying that that's illegal?
That's correct.
Well, my job is to uphold the Constitution. I'm going to take an oath to uphold the Constitution, and I will administer the law and uphold the Constitution.
Yes.
Mr. Chairman, I believe under what we've discussed, I control 5 minutes. I'm going to take one, give one to each of my 4 colleagues that remain.
All right, and I would just say this vote, they're going to call it in about 8 minutes.
Thank you.
So we have very little time.
All right, they're gonna start voting.
Ago, colleagues, I asked
They're gonna start
Mr.
voting.
Kennedy to reconcile his many anti-vaccine statements with his handful of pro-vaccine statements. Instead, he gave us a word salad and ducked the issue. The same was true, Mr. Kennedy.
That's how they do. They try to slander him, right? Oh, he's a bad dude, right? Nobody's gonna vote for him. That guy loses his credibility instantly. Once we find out who he is and we get his face and name spread, that guy loses credibility instantly. And anybody who doesn't confirm him, we see you, we know who you are, and so yeah.
Just want to tell him it is all about you, because I find your presentation to be both untrustworthy and unprepared, because my colleagues have been seeing
What was untrustworthy and what was unprepared?
it's not clear which program you're using when. So I want colleagues to know there is a lot more information.
This guy's taking money from Big Pharma, probably about $300,000 from Big Pharma plus.
Not make decisions on the basis of this session. I thank you for the additional time. And I guess my next minute is Senator Whitehouse.
I'll use my last minute.
And again, 1 minute is please.
This nigga used his minute to throw shade at him instead of addressing the actual problems. And yet people think that Democrats and liberals think they care about you. And I don't even give me to the Democrat, the Republican, I'm not nothing. I'm for the people. But that's obvious. That's obvious they're trying to slander him.
The family has painted the room. It has bought the crib.
It's laughable.
Maybe
It's
even
laughable.
decided on the
It's
baby's
laughable
name.
at this point, honestly.
And has gone to the hospital to welcome the new baby into their family in what is supposed to be a happy event. And then things went wrong.
What are they
Then
showing a
the
video?
alarms started pinging. The lights started flashing. The medical professionals started rushing in. And the question became, who lives and who dies? The mom's life is often at risk, and she may have other children she needs to care for. The baby's life may be at risk, and one or both may die. In that environment, the doctors and the family own that decision. Government has no place in that room at that point. And I think we need to understand when this late-term abortion gets bandied about, what you're dealing with is a tragedy that is happening to a family who wanted that child and have suddenly been confronted with a moment in which they have to make what is probably going to be the worst decision of their lives. And to try to shove the state legislature into that room is really offensive, really morally wrong. And I just want to make very clear what Rhode Island OBGYNs tell me is the situation when these procedures have to be deployed.
Senator Warren.
Thank you, Mr. Chairman. So, Mr. Kennedy, I wanted to ask about your role in the 2019 measles outbreak in Samoa. In July 2018, 2 children died immediately after receiving a measles vaccine that nurses had mistakenly mixed with a muscle relaxant. The nurses get charged with manslaughter, but vaccination rates go down. I asked you about this in my office. You told me flatly that your visit to Samoa had nothing to do with vaccinations. We now know that's not true. I have the documentation. You met with the Prime Minister, you talked about vaccinations. You met with an anti-vaccine influencer who described the meeting as, quote, profoundly monumental for this movement. So what happens? Vaccinations go down, there's a measles outbreak, and children start dying. But you double down. You didn't give up. Just 4 days after the Prime Minister
Try to slander him. They try to slander him again. He's anti-vax. He's anti-vax. He just wants safe vaccines. That's Elizabeth Warren. She also got 500,000 plus from Big Pharma. You wouldn't know that because she don't tell you, but she does. She got a lot of her contributions to her campaign is from Big Pharma. And I can show you my sources if you want.
Disinformation dozen. Multiple.
It's okay, because nobody likes her. Nobody likes you anymore, Pocahontas.
They say the
Nobody likes you anymore, Pocahontas.
It's not biologically possible what you claim.
And quite frankly,
and yet ultimately more than 70 people died because they didn't get vaccines. So my question is, do you accept even a scintilla, just even a sliver of responsibility for the drop in vaccinations and the subsequent deaths of more than 70 people? Anything you do differently?
No, absolutely not. There were 2 incidents in which children died. In 2015 and again in 2015, it was from the measles vaccine. That's what the New Zealand General Hospital found. The government of Samoa banned the measles vaccine after the 2018. I arrived in July of the next year after the ban had been in place for a year.
Mr. Chairman,
and the measles.
Understanding that you wanted to hold this to a minute and that I don't get to present all the facts and documentation I've got, how about if we just decide to make entries for the record on exactly what the record shows about Mr. Kennedy's participation? And I think he's answered the yes or no question. He takes no responsibility.
Senator Warren, we will do that. And Mr. Kennedy, and to all the senators, every senator knows that following this hearing, they will be able to ask you questions
looking
off
at
the
this.
record, and you will be able to put answers back onto the record. So please give that answer. I
How pretty.
apologize that we're shutting you off for giving a full response right now.
How pretty is that?
Senator Smith.
Yeah, they won't even let him.
We are way over time.
They don't even let him finish his
Mr.
sentence.
Kennedy, you have said that you want to give infectious diseases a break for about 8 years. You spoke
don't
about
even
this
let
with
him finish
Senator
his
Cantwell.
sentence.
My question to you has to do with avian flu. Over 100 million birds called. The disease has spread to dairy cows, and there are now 67 confirmed human cases and 1 death. So, Mr. Kennedy, do you?
So basically, this is their last attempt. Mostly Democrats. I can just kind of picture in my head what's going on. This is mostly Democrats. I can't see any Republicans that's not supporting RFK. I couldn't see it. So this is mostly Democrats, largely paid off by Big Pharma, Big Agriculture, Big Sugar, and so forth. And this is their last little push to say, Kennedy, you bad dude. And maybe to sway a vote or two so they can continue getting paid by Big Pharma. At the end of the day, they don't really care about the American people. So this is their last little power grab, if you will. Go ahead, have it while you can, because your power, and that's the thing, right? So like, let's say I'm right, and it turns out I was right. That increases, right? That increases my credibility, I guess. But if you're wrong, and we know you're wrong, and it's proven that you were a sellout, that's why CNN and MSNBC, and that's why mainstream media is at an all-time low. Put it like that.
The point that I'm making is that the folks that they're insisting need to work, 90% of those folks are working. They are caregivers, or they have a disability. Let me give you one example. A woman I think of all the time. Her name is Heather. She's a traveling nurse from Dalton, Georgia, who falls into the Medicaid coverage gap. Heather experienced a series of small strokes, leaving her unable to work full-time. She's dedicated her life to caring for patients, but now she can't afford her own medical care, out-of-pocket costs, because she doesn't make enough to qualify for tax credits to buy private insurance. What does Heather need? Does she need work requirements, or does she need access to health care so she can finally
She
get
needs to look at the foods that's killing her in the first place. Maybe those French fries. Maybe all the poisons, which is why he's here, right? Let's address the root cause so we don't have to go to the doctor. I know hospitals make a lot of money. I know pharmaceuticals make a lot of money. I know pharmacians and missions, they make a lot of money. But maybe if we address the root problem, the shit we're actually putting in our body, maybe we don't have to do this, right? It's not rocket science. It's not rocket science, man.
The Iowa Finance Committee throughout a rigorous process, and I want the whole
And just
world to know that you
Just the dirty game that they play is just
answering questions outside of this hearing and providing documents and responses on issue after issue after issue. You've gone through the most thorough vetting process that any committee in this Congress puts anybody through. And I think that you have come through well and deserve to be confirmed. I would like to remind my colleagues that the deadline for submitting any questions for the record is 5 p.m. today. 5 p.m. today. And Mr. Kennedy, we ask that you respond to those questions as quickly as you possibly can. With that, I'm going to leave you in this room and run over to vote. This hearing will be adjourned. I still encourage the audience to be polite and respectful no matter what side of the issues you may be on. And
Yeah, are we
Mr.
lagging?
Kennedy,
What are
I
you-
look forward to working with you.
Thank you, Mr. Chairman.
We're adjourned.
that is what leadership looks like. That is what leadership looks like. That is the will of the people.
The same as owning Bitcoin
That's what-
directly? While Bitcoin ETFs might offer a familiar face, they lack the true ownership and flexibility of directly.
Oh, it's still on. This is what leadership looks like. This is the will of the people. This is letting the people's voices be heard, right? Letting the people's voices be heard. And Robert F. Kennedy hears us, and he said, "Give me a sword and some ground to stand on, and I'll take back your country." And by God damn it, right? And this is even with the corrupt media and how they didn't let him on the debate stage, even though he was the only one that met the criteria, blah, 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 go on. Right? But that's the will of the people, man. So when do they vote? When the hell is the vote? Look, I mean, look at this shit. Look at this shit.
It's too expensive. This lunch at McDonald's just cost me $18.50. Let me show you how I can make a healthy lunch at home that would cost far less than that. Look at the difference here, guys. I just made this healthy lunch. Grass-fed beef burgers with raw cheese, organic chicken, tallow, potato fries, and fresh squeezed orange juice for about $9.50. But wait, Paul, you say, I don't have time to make this healthy food. Well, how long did it take you to drive to McDonald's? And how long did it take you to sit in the drive-thru? And how long did it take you to drive back from McDonald's to your job? Because making this took me about 25 minutes. Think about how much better you're gonna feel and how much more productivity you're gonna get in your job, in your
Paul Saladino, Cali Means, man, you need to know them. Paul Saladino and Cali Means, man, they're very important in this Make America Healthy Again movement. When do they vote? Speaking of shills, Senator Warren, I called it. I called this stuff, y'all. I called it. Y'all think, oh, Chris, you don't know because you just be. I call this stuff. It's not hard. Show me the incentive, and I'll show you the outcome. Right? It's in the pudding. Right? 2.3 million. Top industries, federal election data for Elizabeth Warren. She got 2.3 million, and we wonder why she doesn't like RFK. Well, you're probably going to hurt her pockets. But like I said, Cali Means, Paul Saladino, 2 names you need to know. I need them to answer yes or no. I'm not going to give you a yes or no question. That's not a subtle, too honest. Okay. RFK shuts down nitpicking from Senator Cortez. The ship is sinking, Senator. Are you going to be a rubber stamp for this administration? Yeah, so we watched it all. We talked about it, man. Another day in politics, if you ask me. It's a dirty game. It's a dirty game. Whoever came up with a 30-minute lunch break need a 30-minute ass whooping. It's a dirty game. So now we're just waiting for his confirmation. Anyone that are either opposes Robert F. Kennedy becoming HHS secretary is either corrupt or dumb, or both. So that's what you got going on there, man. And we're going to wrap it up right there. Hopefully you enjoyed the stream. Love y'all, man. I'll see y'all later. We'll probably stream later on tonight, man. I'll keep you guys updated on this hearing, man. We're going to follow the whole case until the man gets confirmed, man. We're streaming on YouTube and Twitch today. Hopefully you like that little switch up, right? Probably back on here later. We need to see how the votes go to get him actually confirmed. I don't know if he was actually confirmed, but it looks like he is very likely to be confirmed. I mean, I guess we can get a match in. Get a match in. It ain't gonna kill us. It ain't gonna kill us. It ain't gonna hurt nobody. Look at this. I don't want to buy it. I don't want to buy. God damn. I want to play Overdrive. I might do Nuketown. Might do Nuketown 24/7 real quick. That might be fine. Ooh, we got Domination Nuketown. Domination Nuketown. Domination Nuketown.
Get a UAV on grid.
What it do, teammates? What it do?
Grenade.
Domination.
Deploying RCXD.
Using Molotov.
Task napalm strike on the transmitted core.
Chris, why are you saying like that? I feel like saying like this. We need headshots too. I forget we need headshots.
Throwing incendiary.
Securing C.
Flank.
Losing Bravo. We're losing Alpha.
Pop! Pop goes the weasel. Like, why is that guy there, man?
The lead is ours.
Oh shit. Oh shit.
Taking C.
Yeah, the wide open shot on me. What we don't want is we don't want them getting behind us. That's what we don't want. Here we go.
Securing Charlie.
There we go. We got 2 kills with that Molotov. Or 1. That's my teammate. Get him. Up right here. We don't need to play it crazy right now. Just like this. Throw that smoke, throw them off a little bit.
RCX deactivate.
These niggas cannot get out the spawn, damn. That's cool with me. That's cool with me. Makes for an easy match. Easy W.
Locking down Charlie.
Scout pulse, standing by.
Using scout pulse.
We like easy wins, no?
Molotov going out.
Friendly,
Deploying
friendly.
smoke.
Hey, when they go friendly, friendly.
Taking C.
Friendly, friendly.
Your trophy system was eliminated.
Throwing incendiary.
Okay, we're good. We're good.
Securing C.
Enemy found.
I wanted the headshot, but I didn't have headshot time. Friendly, friendly.
Enemy down.
I'm dead. No, I'm not. Fuck! Too greedy, bro. I got too greedy with it.
Using stun.
Get down, frag.
Why was dude just laying there, bro? That should be killing me.
Grenade incoming.
This should be killing me, bro.
Threat deleted.
Losing B.
Driving RCXD.
We lost B.
One of your trophy systems has been destroyed. Deploying
Cover me, taking the objective.
Controlling Bravo. Enemy RCXD detected. Locking down Charlie.
Enemies destroyed your trophy system.
Bravo zone secure.
Damn.
Get down.
Tally. Securing Charlie. Losing Bravo. We're ahead, but stay alert. Marshall's people are no fools.
The headshot is so satisfying. The headshot is so satisfying. Plus, that's what we need. We need headshots, so that's really the only reason. One more.
All threats neutralized. Scour the area.
20 and 11.
That is how you execute.
Right where I left you. Enemy on foot.
This nigga Art, he got a standing ovation. All right, man. Hopefully y'all enjoyed it. We'll be back on here later, more than likely. Just wanted to hop on here and talk about RFK for a minute. His hearing was today. It's a big deal.